Losing weight and being healthier are on the top of everyone's to-do list. Despite the best intentions, work, kids, and social obligations often push lifestyle changes to the bottom of the list. While many people are familiar with type 2 diabetes, few are aware of prediabetes, a serious health condition that often leads to type 2 diabetes. People with prediabetes have a higher than normal blood glucose level, but not high enough yet to be diagnosed with type 2 diabetes. 86 million Americans, that's 1 in 3, have prediabetes, maybe even you. Talk with your doctor, get tested, know your numbers.
I want to be a ballerina.
My hopes and dreams for Layla are that, she does whatever she wants in life. Layla was misdiagnosed 3 times. Go ahead and wipe your finger.
138.
138. Very good. She became really lethargic one day, and so her sugar was almost 700 by the time we got her to the hospital. The doctor told us that if we had not brought her in when we did, that she would have been gone in a couple days. All right, are you ready to call Daddy?
Yeah.
My husband's in the military. He's in the reserves.
Hey, Daddy.
He's also an OR nurse at the VA hospital. And so I do most of Layla's care on my own.
I don't want yogurt.
Well, we have a lot of carbs for this meal, and so we need to have some protein. You have to carb count, you have to weigh food, check sugar, all of that. People don't understand that type 1 is an autoimmune disease. Her pancreas does not produce the insulin needed to live. The Omnipod is the pump she uses. It's tubeless. We have to change that every 3 days. Well done. She's worried about you. What are we waiting for? Cried the lion. Nighttime is the worst. I live in fear every time I lay my head down, wondering if Layla will wake to see another day. If I should die before I wake, it's really, really hard. I don't wish this on anyone. Your life revolves around keeping your child alive. She went through scent impression training, and so each glucose number has a different smell. Jubilee is trained on Layla's scent.
She alerts Mama so she can tell Mama if I am high or low.
She's also gone and fetched the meter.
Thank you. Good girl. Good meter.
Seeing Layla go through what she does on a daily basis has made me want to be a stronger person for her and for myself. My goal is to not only be the best mom that I can be, but to educate and advocate in her honor.
They stole our hearts and inspired us to do more for diabetes.
We were able to raise funds for JDRF and also raise funds to give to diabetes camp as well.
Having Amy and Layla come to our district meetings to speak, it made a positive impact on a lot of clubs.
As Lions, we're happy to help spread the word with Amy and Layla about diabetes.
Best day ever!
I don't want diabetes to ever stop her. We want her to look at the world and know that she can take it on.
More than 30 million people have diabetes, and 1 in 3 of them don't know they have it. People with diabetes are twice as likely to have a stroke or a heart attack as people without diabetes, and at an earlier age. In the last 20 years, the number of adults diagnosed with diabetes has more than tripled. Diabetes is the 7th leading cause of death in the U.S. and causes more deaths each year than breast cancer and AIDS combined. Know your numbers, call your doctor, and get tested. Stop diabetes before it stops you.
Hello everyone. Good day to you all. Sending my greeting to all the viewers who have joined us today all over from the world. Welcome back to session number 3, day 2 of the Lions Diabetes Symposium. What an amazing session we had this morning, where we had lots of honorary representation from JDRF. Lion Donna Fidel, thank you for educating us all on type 1 diabetes. Lion Dana Castero for bringing your son and grandson who shared their insights on different aspects of living with type 1 diabetes. Thank you, Lion Tom Dini. I felt your emotions as you were speaking to us. Thank you for serving and staying strong. And Amy and Layla, I know it turned up everybody's emotions. Thank you so much for sharing your story. What a heart-touching story it was. You've touched many hearts, and we hope many of the people have been impacted and have learned a lot from just hearing and listening to you this morning. So I want to start off by saying that people living with diabetes and all those who are taking care of their loved ones who have diabetes do go through a lot of emotions. And I find that that is normal. And key is education about this chronic disease and also learning tools for self-management. Now, with that said, I want to kick off this afternoon's session. I do have here with me Lion Mahesh Chitnis. If I don't recognize him at this point, it would be an oversight on my part. Lion Mahesh Chitnis, PCC MD16, Area Leader, Global Action Team. I have worked with him in the past few weeks, and I would say, his leadership, his vision, his dedication to bring me along, and we are here bringing this representation to you all. We hope to make a difference. Lion Mahesh, if you would like to say a few words now, please.
Thank you, Lion and Anju. Thank God you did not use the word attention to detail because in the morning we all got so emotional that we skipped thanking our sponsors. So before even starting our session today, I would like to thank our sponsors and everybody who is behind this symposium. First of all, let me thank the Plaza Pharmacy. They have donated the glucometers that would be given for free to anybody who requests that, especially from New Jersey. We won't be able to do the international shipping, but we would give it to the people in the United States. They also have offered to give the management medication to anybody with proper prescription and who don't have insurance. They're ready to do that. So they are one of our sponsors. We have Meena Upadhyay, who is a financial service professional. She helped us in the taking care of the financial aspect of certain things. Even if it's online, it does take a good amount of financing to run these shows. We also had financial support from Pooja Amit Azad, Lion Jyoti Sahani, Lion Revati Taneja, Seema Chawla, Navrang Dance Academy, and Chitnis family. I also didn't thank the symposium team this morning. My co-chair is Lion Anjupuri, and we have the Lions and Leos from number of clubs, 5 clubs: Edison Visionary, Menlo Park, Old Bridge Visionary, Middlesex Visionary, and New Jersey Fitness. So thank you all for your support. This idea came about a few weeks back when Anju, who is the peer support group trainer with the Rutgers self-diabetes management program, and she brought this idea up, and we started working on. And I'm the type 2 diabetes. I have type 2 diabetes, so I go through this all the time. So we decided to make it a 360-degree program. So we have on the Diabetes Alert Day, which is like the fourth Tuesday, which was 23rd March, fourth Tuesday of March, we had this program, and on that day we focused on fitness. This morning we focused on type 1 diabetes, and now we are focusing on type 2. With that, without going too much into the details, let's kick it off, and let's get back to the education awareness, and which will lead to the early detection. That is what our goal is from this program. Okay. Thank you so much, Anju. And without further ado, let's start the program.
Great. Thank you, Lion Mahesh, again. And from my side, thank you to all the supporters who helped us to bring this idea through execution today. We could not have done this without you all. So without further delay, I'm going to kick off our first session, which is focused on understanding and management of type 2 diabetes. And I am honored to introduce to you all our next two speakers who have joined us from Rutgers State University, which is my home state, New Jersey. Ms. Shailja Mathur and Ms. Shuchimita Datta are here with us from Rutgers. Let me go ahead and give a brief introduction, and I will get them on board. Ms. Shailja Mathur, I've known as a friend for a long time, but professionally, I've been working with her for past 3 years, but it goes back a few more years when I started getting emotionally connected to diabetes. Ms. Shailja Mathur is a registered dietitian nutritionist, certified CDC lifestyle coach, certified peer leader for the Stanford Medical School, diabetes self-management, chronic disease self-management, and cancer survivorship programs. Inspired by the work of Diabetes Sisters, she runs multiple monthly support groups for people living with diabetes. Shailja has provided leadership to nutrition education outreach projects on behalf of Rutgers Cooperative Extension at the national, state, and country level for the last 20 years. Shailja hopes to continue to positively impact the lives of community members in areas of healthy living and chronic disease prevention. And if you tweet, which is something I learned, you can follow her at RDNS We will display her contact information as well. Dr. Shuchimita Datta, thank you for being with us. Dr. Shuchimita is a scientist and an educator. She's an associate research professor at the Institute for Quantitative Biomedicine at Rutgers University. She's the scientific educational development lead for the RCSB Protein Data Bank, an international archive of biomolecular structures. She's also a member of the Cancer Pharmacology Program at Cancer Institute of New Jersey. Dr. Datta works with and trains a broad range of audiences, ranging from high school students, undergraduate students, and their educators, graduate students, and research scientists. In the past 3 years, Dr. Datta has collaborated with Ms. Shailja Mathur to develop educational material and train peer leaders. The goal of these efforts is to help community members understand aspects of the inner workings of their body impacted by diabetes so that they are empowered to better manage their condition. And with that said, I'm going to hand it over to you two, and please help us raise awareness and educate our audiences. And, I'm sure, everyone is here and can't wait for me to stop and you guys to start talking.
Thank you, Anju. Mahesh, perhaps we can have the slides up. Thank you. Take it away, Shailja.
Okay. Thank you, Anju, for the kind introduction. Greetings from New Jersey. to all of you around the world, wherever you are on our beautiful planet. Thank you for joining us for this important conversation about diabetes. I want to thank Lions Club for providing us a platform to share our work. I feel very privileged today to share this platform with Dr. Datta, whose friendship I have enjoyed over the years. Thank you, Dr. Datta. And next, please. Okay, today we will begin with some sobering statistics. So what you see on the table are projections of diabetes incidence globally. I want you all to look at two things here. If you see the arrows, in 2019, about 463 million people were living with diabetes. But look at that number in 2045. This number is projected to increase to over 700 million. The incidence rate increases to about 10.9, which means that for every 100 people in the world, 11 of them will at that point be living with diabetes. Now notice the health expenditure on the last line. These are some alarming numbers. It is jumping to $845 billion, billion with a B, which is 11% increase in 25 years. Next, please. So on this table here, let's look at the top 10 countries with the highest incidence of diabetes in the world. You can see that China and India hold the first and second spot. And we are projected to be on the top for another 25 years, followed by United States at the third position. But by 2045, Pakistan will overtake the United States to take the third spot. And you can see all the other countries that are listed here. Turkey moves in 25 years, and there's a little bit of changes, but most of all, these countries are holding on to their prevalence at a pretty strong state. Next slide. So the question now is, why did I share those alarming numbers? And why are we virtually gathered today to talk about diabetes? And the answer is because diabetes is the 7th leading cause of death, and the disease affects many organs in our body. Majority of people living with diabetes die of heart disease. There is a very high incidence of kidney disease, nerve disease, eye disease, and as the disease progresses, lots of organs in our body are affected. Next, please. Here is an overview of today's session. We will start by discussing types of diabetes. We will discuss the concepts behind the rise and fall of blood glucose in our body. And then we will share some treatment modalities and how they work. We will end by leaving you all with some actionable tips and share why support is important in the management of diabetes being a chronic disease. Next, please. So let's begin with types of diabetes. Here is a great infographic from CDC, and some of you might have already seen it. I want you to look at the middle column. That has the levels for fasting blood sugar. Normal levels for a healthy individual should be below 99 milligram per deciliter. Now, if you have prediabetes, they range between 100 to 125. And a level of 126 or more becomes classified as diabetes. For the last 10 years, the hemoglobin A1C, also known as HbA1c, is the test that has been used more commonly. And this test gives the percentage of glycosylated hemoglobin or an average blood sugar for 3 months. And we will talk more about this test in the coming slides. Next, please. So you have all heard about type 1 diabetes in the morning, and we saw how emotional that session went. We now know that type 1 is an autoimmune disease, and it requires insulin as the first line of treatment. This afternoon, as Lion Chitna said, we will be focusing on type 2 diabetes and its management. So type 2 diabetes is a chronic disease of both glucose and fat metabolism. It is a progressive disease and the most common type of disease. If you see 90 to 95% cases of diabetes are actually type 2 diabetes. It can be treated with lifestyle changes and medications, and sometimes it may need to include insulin in administration also. The next one I want to talk about is gestational diabetes. It is the kind of diabetes that occurs in women during pregnancy. And more than half of the women who have gestational diabetes, they actually end up with the onset of full-blown type 2 diabetes within 5 to 10 years of childbirth, unless they have been provided proper guidance. There's another type of diabetes that I also wanted to mention since we are talking about different kinds of diabetes, and that is called induced diabetes, or rather secondary diabetes. A number of medications have side effects, which include the raising of blood sugars and increasing your weight. And sometimes this high blood sugar resolves or is reversible when the medication is stopped, but in many cases, unfortunately, it precipitates diabetes permanently. Now, these medications are steroids. They could be diuretics that are used for the treatment of hypertension or blood pressure. They could be beta blockers, which are prescribed for heart disease. Or they could be the antipsychotic drugs that are used for treating dementia or conditions like schizophrenia. Statins may also cause high blood sugar. So being on smaller doses of these drugs or taking them for a shorter duration may sometimes help reduce the likelihood of developing diabetes. And another thing that I want to mention today is that in the past year, many of you may have heard that COVID-19 survivors are now ending up with diabetes. Next, please. So I was very happy to see the video that played right before our presentation, and I think it gave this message quite clearly to all of you. But I feel very strongly that we must, at this juncture, talk about prediabetes, which is not a kind of diabetes, but it is a condition that occurs right before diabetes actually precipitates. Prediabetes is what many of us know as borderline diabetes. It is when the doctor tells us to be careful of what we are eating, start exercising more, as our blood sugar numbers are kind of creeping up, but they're not quite where they can be treated as diabetes. This, I feel, is a very critical and time-sensitive window for us to take necessary and aggressive action to delay the onset of diabetes. Either of two things are happening at this time. Our fasting blood glucose levels increase to more than 100, but they're still below 126. And or our 2-hour, which is also known as the PP or the postprandial numbers, they start to run higher. So our glucose tolerance reduces and our insulin resistance increases. Oftentimes, gaining weight is the culprit behind all this. And particularly abdominal weight. At this time, our HbA1c, the test we talked about in the previous slide, falls in the range of 5.7 to 6.5%. And I would suggest that you try to consult with a doctor and a registered dietitian and focus on getting your numbers back to a normal range of HbA1c, which would be less than 5.7. And the sad part is that 9 out of 10 people living with prediabetes do not know that they have it. So I urge you to be screened regularly if you are at risk. Next, please. At this point, I want you to take a pause for about 30 seconds. I want all our listeners to reflect and think whether you are at risk of diabetes or actually you have been told you have prediabetes. Next, please. Okay, so now that I give you a chance to think, I hope that some of you were able to think about the risk of having prediabetes, increasing the risk of precipitating with type 2 diabetes. So what you see on your screen now are a list of risk factors. So if you have prediabetes, it is a risk factor. If you're overweight, it is a risk factor. More than 45 years, that again increases. If you have a family history, so it could be a parent, a brother, or sister with type 2 diabetes, you have a higher risk of getting diabetes. There are also incidents of diabetes where there's no family history, but for the most part, diabetes does run in families. If you're not physically active, that increases your risk. If you have had gestational diabetes, or if you're a woman that has given birth to a baby who weighed more than 9 pounds, you are at higher risk of getting type 2 diabetes. Some of the ethnicities are also at higher risks. Among them are African Americans, Hispanic or Latinos, American Indians or Alaska Natives, and Asian Americans. They are all at higher risk. So just the fact that if you're born in one of those ethnicities, you run a higher risk of precipitating with diabetes. And then there are some more risk factors that are not included in the list above, but I want to mention them. They are hypertension or blood pressure. If you have your triglycerides elevated, you need to focus on getting them down because they are a risk factor. If you have polycystic ovarian syndrome, which is known as PCOS, that's another risk factor. Impaired fasting glucose. So anytime your numbers in the morning sugars start creeping up, that's time for you to have a conversation. If you have what is known as acanthosis nigricans, which is this dark skin pigmentation that usually occurs on your neck and sometimes in your armpits, and any history of vascular disease, whether it's peripheral or arterial or heart disease, they all increase the risk factors. And something where a lot of people don't talk about, if you smoke, smoking increases your risk of getting type 2 diabetes. So at this point, now that we know the risk factors for diabetes, we're going to shift gears and we're going to try to understand the inner workings of our body that is impacted by diabetes. And we're going to dive a little bit deeper, and I'm going to invite Dr. Datta to take over from here.
Thank you, Shelja. The next slide. So, in discussing diabetes, one thing that we always talk about is the high blood glucose. But actually, because diabetes is a metabolic disorder, there is also the low blood glucose. That is something that needs to be considered seriously. And it is this business of high and low blood glucose levels that fluctuates and is not well managed in individuals who have diabetes, that causes all kinds of problems and some of the complications that you heard about earlier. So, what we are going to do in the next few minutes is to try and understand why is it that the blood glucose, first of all, rise and fall, and we're going to follow the path of glucose in the body. And then we will also learn a little bit about insulin. We've heard a lot about insulin. So, what is the relationship between glucose, insulin, and diabetes? This is what we are going to try and do in the next few slides. So, next. So we are going to start with something that is very, very fundamental and try and understand where is this glucose even coming from. So primarily it is coming from our food. Now the food, you have to know, is not only made up of glucose. There are carbohydrates of simple and complex types, but there is also protein, there is also fats, there are fiber, minerals, other things in our food. But in this particular discussion, we are going to follow the glucose. So we're going to focus mostly on the carbohydrates, sugar, and glucose. So carbohydrates are actually complex molecules of glucose. They have to be digested and broken down into glucose and other simple sugars in order for our body to be able to absorb it. And so when we eat, let's say we ate an apple, so the sugar and carbohydrate present in that apple has to be digested. And after it is digested, so the digestion starts in our mouth, it continues through our stomach and intestine. Once it is broken into this simple glucose molecule, that is absorbed in the blood. And you can see blood glucose shown in the middle of this slide, where from that blood glucose, the glucose will enter into cells, such as muscle cells, which is shown at the bottom of the slide, where the glucose will provide energy for you to move around, walk, run, jog, etc. And that same glucose is also going to provide energy for growth and repair. This process of taking glucose from the blood into the cells is facilitated by this hormone called insulin, which you're seeing as this blue molecule shown in the slide. Now, the glucose that enters the cell is, like I said, used up for energy and growth, but anything that is not used up is stored in the form of glycogen for use later when you don't have ready access to glucose. Now, the biggest organ that stores glycogen in our body is the liver. Next. So the liver actually takes the blood glucose and stores it in the form of glycogen so that in times of starvation, for example, every night you have your dinner and then the next meal is maybe 6, 8, 10 hours later, your breakfast. So in this interim period, the glucose needs are replenished by breaking down glycogen from the liver. And so there is this release process that happens. And this release is actually regulated by this hormone called glucagon. Okay, this glucagon and insulin, both these hormones are actually produced by the pancreas. And there is this nice balance that has to be maintained between insulin and glucagon in order for our body to be able to manage the blood glucose levels in a reasonable level. Another organ that plays a key role in this whole glucose regulation is the organ called kidney. So the normal kidney function is to filter out waste materials from our blood and flush it out into the urine. But while this happens, as the blood is filtered through the kidney, the glucose is also filtered out. In a healthy kidney, this glucose is not allowed to go out into the urine, it is absorbed back. So there is this reabsorption process. However, if the blood glucose levels are really, really high, the kidney actually allows some of that extra glucose to flush out through the urine. And in fact, that is what causes some of the first symptoms that people may notice people who have diabetes is this excessive urination. So this excessive blood glucose is causing the kidney to throw out the extra glucose, and the individual is then feeling thirsty and hungry and so on and so forth. So the key organs that I wanted to put up in front of you, of course, is the whole digestive system, the liver, the kidney, and the pancreas that is putting insulin into the picture. And without insulin, of course, the cells cannot take up glucose from the blood. There is one other idea I wanted to introduce here, and that is the regulation of the insulin release. So one mechanism that triggers insulin release is the presence of high blood glucose. So when you've eaten a meal and the digestion has happened, the blood glucose levels rise. And that tells your pancreatic cells that, okay, it's time to release insulin because now the blood glucose needs to enter into the cells, muscle, fat, and other cells. There is another regulation pathway, and this regulation pathway is through this molecule. This is another hormone called the GLP-1. So this is GLP-1 is produced by intestinal cells, and it is produced in a short burst. When the food is going into the intestine, GLP-1 is produced to tell the pancreas that it's time for you to get ready, because food is in the intestine, the blood glucose levels are going to rise, so get ready to produce insulin. Remember that this is a short signal, and the body has its own mechanism to shut it off after that signal has been produced with an enzyme called DPP4. So next. So here you will see that after a few minutes of the GLP-1 producing that signal, it is destroyed. Okay, so that the signal is short, it's a short signal, and now the pancreas knows that I need to produce insulin in order to allow the blood glucose to enter to the cells. Now, what we are going to do in the next few minutes is we are going to watch a video that actually dives in deeper into this whole insulin guiding the glucose into, or allowing the glucose to enter the cell. This is going to be the focus of the video that you're going to watch in next. So can we play the video? Do you hear the sound? I don't hear it. Yeah.
In this painting by David Goodsell, you are looking at the boundary of a cell. The blue and purple bits are the inside of the cell, and the brown part is the outside of the cell. The green cell membrane separates the outside from the inside. The focus in this video is to understand how glucose molecules, shown as white specks, enter into the cells. A key player in this process is the hormone called insulin, shown as the yellow blob on the outside of the cell. When it binds to its specific receptor, the insulin receptor, it triggers a number of changes within the cell, and a series of signaling steps happen that communicate the insulin binding outside of the cell to a number of proteins that tell vesicles that are sitting inside the cell to move outwards. The vesicles contain specific transporters called glucose transporters, and it is through these glucose transporters the glucose will enter the cell. Once inside the cell, the glucose is either used up for energy or growth, or stored in the form of glycogen, shown as these purple branched structures. When there is an excess of glucose outside the cell, insulin is produced. The insulin binds to the insulin receptor on the membrane of the cell and begins a series of signaling steps that tell pieces of membrane within the cell, called vesicles, that have the glucose transporters in them, to move out to the cell surface so that glucose from outside can enter the cell. Since insulin is critical for beginning the process of glucose uptake, If insulin is missing, the entire process of glucose uptake stops. The glucose remains outside the cell, and the cells are unable to utilize it. This is, in fact, what happens in type 1 diabetes, and the only way to treat it is to provide insulin by injection. Insulin signaling is a rather complex process involving many proteins that talk to each other inside the cell. If any of these proteins are either missing or not functioning properly, the signal that tells the glucose transporter to come up to the cell surface is blocked. The net result is the cell is unable to utilize glucose and can lead to type 2 diabetes or insulin-independent diabetes. This name collectively describes all conditions where insulin signaling may be affected. It is often difficult to specifically diagnose the cause of type 2 diabetes, so the treatment focuses more on managing the overall blood glucose levels within a narrow range than identifying the actual cause of the condition. To learn more about insulin and diabetes in molecular detail, visit PDB 101.
Shelda, you have to turn on your mic.
Yeah. What a great video. Thank you, Dr. Datta. So we have now learned about types of diabetes. We learned the risk factors for diabetes. And with this video and the glucose uptake picture, we now know what is happening inside our body as these changes with prediabetes and diabetes and digestion of food are beginning to happen. When we get diagnosed with either prediabetes or diabetes, what do we do? There is a real component of denial and hesitancy to take medications. So what we do is we first try to use complementary and alternative substitutes, and we try to delay starting medication as long as we can, right? And most of us that are living with diabetes have gone through this sequence. Next, please. So with this slide, the message here is that there is limited evidence-based research on the effectiveness of these CAM alternative modalities, and they do reduce your blood sugar, but they're not standardized. So we do not know how long that action lasts or how much of these things we need. And if you are trying some of these herbs or plants or botanicals, you must let your healthcare provider know, and you must make sure that you test your blood sugar more closely so that you can avoid both the highs and the lows, because as we will find out, they could both be dangerous. Next, please. So once you are diagnosed with prediabetes, as per the recommendation that most healthcare providers or your doctors give to you, they begin by saying that you need to focus on lifestyle changes. And if you all were logged on earlier, there was a video on the lifestyle changes and how important they are. The lifestyle intervention involves combined diet and physical activity interventions. And the important part of this is that there must be the inclusion of interactions with the healthcare professionals for at least a period of 12 months. So that part is really important. And I say that because there is an evidence-based curriculum that the CDC uses, which is called National Diabetes Prevention Program. It is a 12-month program, and you are in constant touch with people that are trained as lifestyle coaches. Now, the minimum recommendation of exercise from the American Heart Association as well as the American Diabetes Association is 2.5 hours, of 2.5 hours or 150 minutes. Let's talk a little bit more about this number as we move to the next slide. So before we jump into learning more details of what I mean by moderate activities, I wanted to leave you with what you can do with your dietary choices, right? So the most important message here and the most surprising message here is watch your serving size, right? Your portion size. Watch your portions, increase your fiber intake. And the most easy way of doing that is by increasing vegetables and your whole grains. Now, there is no one size fits all optimal diet. Registered dietitians have moved away from that concept, and all your plans are now more personalized. And that is also the message that was used for National Nutrition Month, which just passed in March. So next, please. So oftentimes when I talk about recommendations to my audience, they always ask me what counts as physical activity, what is moderate intensity. It's so I want to share that the recommendations are the minimum amount of minutes that are required. And what I want to tell you that if you are able to talk but not sing when you're doing the exercise, that is what would count as a moderate physical activity. And I have listed some examples here on the slide, like brisk walking or cycling or water aerobics or hiking. Even using a manual lawn mower could count as a moderate intensity physical activity. Now, if you don't have that kind of time where you can give 2.5 hours every week and you would like to give lesser time, you could do vigorous physical activity, and that would be jogging or swimming or cycling. But again, if you are going to be doing vigorous physical activity, check with your doctor if you're ready to start that, and start slow. I also wanted to mention here that in 2016, like 5 years ago, the American Diabetes Association recommended that people living with diabetes should move every 30 minutes to interrupt long periods of sitting. And I am checking my phone. We're about the time of 30 minutes from when we got started. So if you have diabetes and you have been watching us for the last 30 minutes or so, I encourage you to stand up and move around a little bit as we continue to talk. Next, please. So while food and physical activity are important aspects of diabetes management, I also wanted to look at this link between stress and type 2 diabetes. So when you are stressed, you will notice that you are more irritable or agitated. You kind of feel a sense of helplessness. You lose interest in taking care of yourself. And most of all, very commonly seen is that you don't want to socialize. You don't like to meet people. You don't want people to come visit you. In other words, you withdraw yourself from people and events. So what can you do? And what is happening? Like Dr. Datta discussed what's happening inside your body. What is this stress causing? This stress is causing changes in your body chemistry in a way that makes you more likely to get type 2 diabetes. So it could cause you to act in unhealthy ways. We all know people who can eat a whole tub of ice cream while working on a project deadline, right? We have all been there. So let's move to the next one, please. So unfortunately, there is no surefire way to prevent stress. It is part of our life. And this past year has been so stressful for all of us. Many of us have lost jobs. Someone you love may have gone to the hospital, and it's just been overwhelming, right? But there are ways to make your life less stressful. And on your screen, you can see some ways to reduce stress in your life. And one of the big ones I needed to learn for myself was to learn to say no. And another important one that I think I need to point out is getting adequate sleep. Try to get at least 8 to 10 hours of sleep, and you will notice your blood sugar numbers improve. I can guarantee that. I can actually put money on that. So now, at this point, let's go back to Dr. Datta and try to understand what is happening inside your body as we're trying many different things, all the, complementary and alternative modalities, and we're doing all we could, but maybe we need a little more help. Dr. Datta, please take it away.
Thank you, Shailja. So next slide, please. So this is, we are looking at the same slide that we saw earlier. And I wanted to sort of refresh your memory in what we saw in this slide. So we saw that the glucose is coming primarily from the food we eat. After it is digested, it is absorbed from our small intestine and it enters into the blood glucose. This blood glucose is used up by muscles. It is stored in the liver, and it is being filtered and cycled back, reabsorbed back through the kidneys. So these are some of the things that we learned about earlier. We saw how pancreas is a key organ that produces these very important hormones, both insulin and glucagon. And like we learned in the video about insulin and diabetes, in type 2, the actual cause of the disease can be quite complex. And so instead of trying to identify and fix the problem at the source, what is usually the approach is to try and manage the blood glucose levels within a narrow range, right? And so with this goal, so if you see the blood glucose in the middle of this figure, in this slide, at the center, you have blood glucose. And you see there are arrows that are coming in to add to the blood glucose. And there is one big blue arrow that is going away, that is taking away glucose from the blood and being used up. And so if you think back at the slides that Shailja was presenting, she talked about monitoring the portion size, the type of food that you're eating. So these were some actionable thoughts that she left you with. And that is actually playing a role in deciding how much glucose you're putting into your system, right? So this is what is entering the system. And then she also talked about exercise. So exercise is what is taking up or using up glucose. So if you are increasing your activity, your exercise, the length or vigorousness of the activities that you're involved in, more of the blood glucose is used up, right? So these are the sort of two first line of the defense that your healthcare provider will probably tell you to take on, is to manage your portion size, change the kinds of food you're eating, and also to increase your activity. But sometimes that is not enough. Your body needs more support. And in order to do that, we often have to resort to medications. And so what are these medications doing? And that is what I'm going to try and explain in the context of this slide. And so the first line of medication that is used is probably metformin. If you are on metformin, you know that this is something that the doctors prescribe first. So the next forward will actually show you where metformin acts. So metformin actually acts so that it prevents this glucose release from the liver. This is reduced. So how does that happen? One is this action of glucagon is reversed. So metformin acts at that level. But what is not shown in this figure is that metformin also, perhaps, so it's not very clear, but it is thought that it also helps the uptake of glucose from the blood into the cells. So it is acting at these 2 points. And this is the first line of defense. Another interesting thing I wanted to point out here is that the liver is a special organ in that it is able to create glucose from proteins and fats in extreme cases of starvation. So if you've not eaten for a really, really long time, not the overnight fasting kind of situation, but if you haven't eaten for a really, really long time, then the liver has that ability. The metformin has the ability to block that. Another organ that does a little bit of this creating glucose from proteins and fats is kidneys, but we are going to not discuss that for now. So the first line of defense we said was metformin, but there are many other medications that you may already know about or you may take that act at various other points. And the goal in all these is to reduce the amount of glucose coming into the blood or to increase the amount of glucose being used up from the blood into the cells. So the next. So here we are looking at alpha glucosidase inhibitors. So these drugs, they act in the digestion pathway. So they interfere with some of the digestive steps so that the food that while it is being digested is not completely digested. And the glucose that is coming into the blood glucose is reduced or controlled. So the next shows you another class of drugs. So these are the SGLT2 inhibitors. So remember I said that the normal healthy kidney, it actually reabsorbs the glucose that has been filtered out. So it comes back into the system. So if the individual has diabetes, one class of medications can act over here where it prevents the reabsorption. So what happens as a result is that any sugar that has been filtered out in the kidney is flushed out. So individuals with high blood glucose will lose sugar through this path. Next. So now here we are looking at two different classes of drugs. Both act on the pancreas to increase the release of insulin. So how would that help? So if there is more insulin, the higher level of insulin is able to facilitate the glucose from the blood to enter into the cell, according to the video that you saw earlier. So this is also, there is another class of drugs next called the TZDs. And these TZDs actually, they make this process of glucose uptake more efficient. So remember we said this glucose uptake is a complex pathway and there is a lot of conversation between proteins that is going on in order to facilitate that. It makes that more efficient. Next. Here is a class of drugs. So remember we had talked about how the body signals, the intestine tells the pancreas to prepare that food is in the system. Now the blood glucose level is going to rise. So this GLP-1 was the messenger or that regulator, which had its own internal regulation by this DPP-4. Now, if that internal regulation is destroyed, so that means this GLP-1 signal can continue to tell the pancreas to produce more and more insulin. So that is one way. And then there is another way where there are actually synthetic or GLP-1 analogs next that can act. And so these are not affected by these gray circle regulators. So these molecules can continue to act on the pancreas and keep telling it, make more insulin, so that there is enough insulin available for the blood glucose to enter into the cells and be used up. So if we step back and look at all this, what we are seeing is that in the big picture, what we are doing in trying to manage type 2 diabetes is that we are trying to interfere with all the processes that add glucose to the blood glucose level. And we are trying to make all those processes that help take away glucose from the blood, that we are trying to make them more efficient by primarily either increasing the amount of insulin available or increasing the effectiveness of how this insulin is acting. So these are pretty much the various classes of drugs that are available and that are currently used. And so if one class is not enough, your doctor may prescribe another class of drugs. So maybe the metformin will be combined with a DPP-4 inhibitor, or it will be combined with a sulfonylurea, etc. And so these combinations are again working so that they can keep the level of glucose in your body in a defined range. Before I step away from this, I wanted to point out that the glucagon that we are seeing here, that facilitates conversion of glycogen to glucose, this is also a very important medication in diabetes for managing the lows. So we've been talking about highs, but there is also the lows. So sometimes people might start feeling dizzy and sweaty, and they start feeling those low jitters. So in conditions when the individual is unable to quickly take some orange juice or some glucose tablets to restore the glucose levels, the glucagon actually as an injection is used to rapidly restore the glucose levels so that the individual can become awake and alert, and then their condition can be managed. So this is sort of, in a nutshell, all the different classes of drugs that are currently used in treating type 2 diabetes. And I hope that with this introduction, you will be able to better reflect on your own medications and think about questions that you would want to discuss with your healthcare provider, and also think about how these medications are acting. Should you take the medication with food, before food, after food, or does food not have any influence on this? So for example, if any of the drugs that you are taking are of this class, where the amount of insulin is increased as a result of taking that medication or injection, you probably need to combine it with food, because otherwise you can have a low blood glucose episode. So this is something very important for you to feel educated and empowered so that you can manage your health, your condition better. Okay, so with that, I'm going to give it back to Shailja to talk about some actionable tips. So we hopefully have some understanding of what diabetes is, how the glucose levels rise and fall, some introduction to treatments, but these are some real life tips that you need to manage your condition. Shailja.
Thank you, Dr. Datta. I just love the way you explain that such a complex diagram, and it explains so much. And I hope all of you listeners have really enjoyed and really learned from that. So I am going to now talk about some actionable tips that you can use if you have prediabetes or diabetes. So let's go there. Next, please. So there are actually 5 pillars to healthy living. And the first one is improve your weight if you are overweight. Second one is eat healthfully. Watch portion sizes, serving sizes. You must try to consume good fats like nuts and seeds. Try and exercise most days of the week, and include all kinds of exercises. So cardiovascular exercise, or better known as aerobics. You must do some balance training, some flexibility exercises like yoga, and always include at least 1 or 2 days a week of weight-bearing exercises. We talked about stress and how important it is to manage stress. And then, of course, the 5th pillar being adequate sleep. And if you have already been diagnosed with diabetes, then in addition to all the above guidelines, you must take your medications regularly. Next, please. So if you are in a country where there are registered dietitians available to help you, you must consult with them. They will be able to navigate you both with prediabetes and type 2 diabetes. They are skilled and professionally trained to help you improve outcomes. In the United States, your visits are covered by most commercial health plans and Medicare, both for the diagnosis of prediabetes as well as type 2 diabetes. So one thing that I wanted to talk about on this slide is people take a long time to accept the diagnosis, and the burden of disease is really high. So it is sometimes helpful to have a care team and You will see that it is helpful when somebody holds your hand as you move into this journey with either prediabetes or diabetes. So these are some takeaways that I hope will be helpful for all of you. Next, please. So we're coming close to the end of our talk, but our talk would be incomplete if we do not discuss support that is needed by a person who's living with a chronic condition, and diabetes happens to be one of the chronic conditions. Next, please. So attending and leading a support group have brought me great joy, and I must personally acknowledge that the returns have been huge. As a person living with diabetes, you must seek support from the people you live with, like your family members, and also try to join a peer support group. And if you don't have one nearby you, I suggest you start one of your own. In the United States, Diabetes Sisters is a nonprofit, and they run many support groups nationwide. And many of them during COVID-19 have converted and become online. So you're welcome to contact them and join one of them. There are people from other countries also who have now started to join these support groups. And so if the time works for you, you're welcome to join them. Just remember that the burden of distress and depression is very high in the people who live with diabetes. And often women who are primary caregivers for the family do not ask for help. I want to say that you must give yourself the permission to rest, to relax, and also to ask for help when needed. Next, please. So 4 years ago in 2017, the American Diabetes Association actually recognized the importance of this support. And in education, in addition to the education component, which is the DSMP, they also said that there is research and evidence that backs improved outcomes for those who seek and have support in dealing with diabetes. So again, this is a really important part of your diabetes management. So do pay attention and try to do what you can to kind of invite some support in your life, because you need it, and it will help you. Next, please. Here, I just listed some benefits for peer support. As I told you before, it does decrease morbidity and mortality rates. There's enough research that says that it has increased life expectancy in people living with diabetes. You learn more about the disease, you learn about the effectiveness, and it's something that I found very useful for me is it is an environment of sharing that is non-judgmental. And there are other people who are also dealing with the same issues, and sometimes their success stories inspire you to make those changes. And that's a really, really priceless component of these peer support groups. And not only the people who attend support groups, but there's now research that shows that people who run these support groups, even they have reported less depression, they have increased their self-esteem and efficacy, and of course, improved quality of life. And we all want that. So if you're interested in more information, I provided a website, www.peersforprogress.org. There's a lot of ideas there that you can refer to. Next, please. We are now coming to the end of our section, and I would like to leave you with some takeaways that you can hopefully implement in your life today. So just remember, I'm saying today, not tomorrow. So let's do it today. You have learned what are risk factors for diabetes, and if you do fall in that category, it is time to start a conversation with your doctor. If you already have been diagnosed with diabetes, your mantra should be self-care. Remember, it is not being selfish, but being responsible when you take care of yourself. We have all seen the demo on boarding an aircraft where we are instructed to first put the oxygen on ourselves before we go along to help the person sitting next to us, right? The same concept holds true here. So by implementing lifestyle changes, you are changing behavior in the areas of food habits, exercise, stress management, as well as sleep hygiene. Now, I want to just caution you as you start on this journey that the process is slow, right? But don't give up. Do not give up. You should try to change your environment related to food. Surround yourself with healthy foods, healthy options. Find people that will exercise with you. Find people that will celebrate in these little successes that you get. And gradually make the changes in your journey of healthful living with a chronic condition. And at this point, I am going to turn it back to Dr. Datta to summarize all that we have covered so far in almost the last hour. Dr. Datta.
Next slide, please. So just to refresh your memory, we began the discussion with learning about types of diabetes. We learned about the rise and fall of blood glucose. We followed the glucose. We learned about the relationship of glucose, insulin, and diabetes. And we learned various treatment options, lifestyle changes, and medications, how they work. And Shelja gave very nice summaries of some actionable tips and discussed the importance of family support and peer support. And so all this that we presented here were sort of excerpts of a program that we've been working on. And Shelja, I want you to tell our audience a little bit about this project and this program. Next slide, please.
Sure. So Dr. Datta and I have a personal interest in this project. This work is a tribute to our mothers, and we wanted to help the South Asian community to deal with this disease. And we received funding from the Office of Minority and Multicultural Health, which is a division within the New Jersey Department of Health. And we have received funding for 3 years. The picture that you see is from our peer leader graduation. We were able to recruit and train 12 community members, very dedicated men and women who we trained as South Asian peer leaders. And they were trained in the diabetes self-management program from Stanford Medical School. This training was conducted by the Middlesex Division of Health Services, by the master trainers that you see sitting in front of the, the picture. And what we have done is that we have used the DSMP curriculum as a framework, and Dr. Datta and I have created additional curriculum, several videos, one of which you saw today, but there are several on YouTube if you would like to see them. Radio shows we have done, and we have also created other resources that add as an addendum to this and target specific needs of the South Asian population. And all our peer leaders are trained on both the DSMP as well as this South Asian cultural piece that we call the South Asian curriculum. And in the next section, we have, you can now see them on the screen, so welcome, 2 of our trained South Asian peer leaders, Anju Puri, who's also a lion, and Suman Dogipati. Together, they are going to co-lead and share some of the work that we had developed through this project. So good luck, Anju and Suman, and take it away, please.
Before we leave the slide, I just also wanted to acknowledge Dr. Nurgul Fitzgerald, who is a co-PI on this team, who has contributed in this project too. Take it away, Suman and Anju.
Thank you. Thank you. Thank you, both Shelja and Dr. Datta, for very, very informative, deep dive educational information that you shared with us on prediabetes and type 2 diabetes. I tell you, your dedication and your passion to help raise the diabetes awareness in general, and particularly within the South Asian community, is very remarkable. I myself feel very empowered to be able to teach or even speak about this topic. I continue to learn. And, I would say, Shelja, you spoke about the mantra of self-care, and that is something that I learned from you and I've implemented, and it's doing good. So I do encourage people to have picked up on that, and all it takes is a little bit of putting yourself first. Next here, I'm going to go ahead and introduce my co-presenter for this segment, Ms. Suman Doggiparthi. Suman is an active community service volunteer, resides in Marlborough, New Jersey, and she has led various committees as a PTO member at local schools in Marlborough. She's also affiliated with the voluntary committee at Hindu American Temple and Cultural Center here in Morganville, New Jersey. And I'll take a few minutes to just introduce myself. I am Lion Anju Puri. I'm the first vice president of Old Bridge Visionary Lions Club and also a resident of Marlborough, New Jersey. I do work full-time in the financial industry, but for the past several years, I have been actively pursuing my passion to give back to the community. I particularly enjoy engaging myself, working with the youth, the smaller kids. I do like to work on projects that involve education. Fortunately, with affiliation with my current workplace, I've been participating in educational programs such as iMentor, Junior Achievement, and have done here and there a few financial education sessions with the business students of Rutgers University. Over the weekends, I also teach Hindi to kids in Marlborough. So, I think it's important that they connect to the roots and the culture. And this is why, the South Asian aspects of diabetes sort of sits in with my passion. Suman and I both are certified peer leaders for the diabetes self-management program that Shelja had shown on the last slide. We were fortunate to have gotten certified and now actively are teaching workshops to raise the awareness of diabetes amongst the South Asian community. We both also have a family history from our mom's side to do this and to help raise awareness. I'm sorry, I didn't expect this. Today, Suman and I are going to go ahead and share with you both some South Asian aspects of diabetes management, hoping you're going to find the information insightful. All right, great. What we show here is a very festive.
You got it, Anju. Go for it.
I love this. And the colors make me want to feel happy. And I'm sorry, I got emotional for a second, which was totally unexpected. But
no problem. Go for it.
It's perfectly all right, Anju.
Thank you. We look at this slide, and it reminds me of my culture. It's festive, it's colorful, it's full of emotions, and that's what South Asians are. We as South Asians also use food as a key expression of our culture. We also have lots of regional foods, right? So our heritage and our emotions are generally connected to food. Our hospitality, the celebrations, the festivals, events we do, all involve cooking, eating, and sharing food. In fact, recently I was on a South Asian affiliation group at my work, and one of the speakers there said, the 5 global known universal love languages for South Asians, we should add a 6th one, which is food, which I thought was amazing because I could resonate with that. Now, although, cultures and traditions related to combination of, different ingredients, our cooking processes may vary. We do realize that when we do, especially celebrate our holidays, most of our cuisine is made up of large proportions of grains, carbs, fats, and starchy vegetables. Oftentimes our foods such as, the gujia displayed here, right? Which, I don't know how many of you have eaten lunch and are ready for a dessert, are very tempting. A lot of our foods that we make for our holidays, like the kheer and all that, is full of rice and, a lot of carbs. chole puri, which we'll come to and talk about, right? Full of starchy vegetables. And oftentimes, it's okay. I loved when Layla was able to say that she was in the morning session was able to say she is able to have a cake and able to have candy for Halloween, and resonated with me because that's the message we want to drive home today. People with diabetes have to learn not only how to eat, but they also have to learn how to manage their emotions. I do want to remind that having diabetes does not mean that you deprive yourself of eating foods, but it's very rightly of making the right choices. So with that, if we can move on to the next slide. I did want to speak about that slide just because it was beautiful and represents our South Asian culture. So thank you. And before I go into more of the South Asian aspect, and Shelja also touched upon it in her presentation, it's very important that we stay mindful of some of these healthy eating guidelines, right? Which is basically, particularly if you have diabetes, I would say, or you are pre-diabetic, and even if you're not, I think what I heard, we have to be our own advocate. Ask for that glucose test when you do go for your, examinations. I think you becoming your advocate is one of the things that I've heard, even when we teach our sessions, is a takeaway that I would want people to have today. So from these guidelines, very general, you want to eat variety of foods. Make sure your plate consists of all different types of nutrients. Make sure you are eating your breakfast, and control the non-starchy vegetables, which someone is going to go ahead into a little bit more detail later. Have more whole grains, and make sure to drink a lot of water. Next slide, please. So, when we are going to get into examples of food, and I think what we want to hone on first a little bit is what is important, especially for the diabetic people, is really to understand what carbohydrates are, right? Carbohydrates are the main source of fuel for our energy, and we cannot just eliminate them because they're the source of energy for our body, right? We need that nutrient to be able to raise, even though it raises our blood sugar, we need that for our body. As Dr. Datta was explaining very much in the scientific way, how the glucose enters our body and travels through the bloodstream, and how the insulin helps the cells in our body to take up the glucose and use it for energy. That process is very important to remember. I think it's an eye opener when we start talking about what a meal means to us. Next slide, please. So we talk about carb counting, and I do want to say there's a lot of fad about keto diet and different diets. We're not going to prescribe anything, but what we are going to do is know what carbohydrates are and why carbohydrate counting is important. Basically, carbohydrate counting is a method we use to calculate grams of carbohydrates consumed at our meals and snacks. A carb choice is a serving of food which generally contains about 15 grams of carbs. I just wanted to pause here because a lot of the information that we're going to share in this segment is built upon that recommended range of carbs suggested in a meal serving. Next slide, please. I kind of hounded on this, that carb counting is not a diet. It is a way that you learn to intake carbohydrates within your meal planning, and it helps you manage your blood sugar levels. So you may feel better, when you are taking the right amount of carbs in your diet. The balance between the carbohydrates you eat and insulin determines what your blood glucose level will be after eating. So I did see some questions earlier on, and I encourage people to, as we go through it, we have the experts online. Please pass on your questions, but it is very important, especially if you're diabetic, right, that you are taking your blood sugar in the morning and especially after the meals, because it's going to give you an indication about how certain foods are working within your body. So, there's no right answer, but I do prescribe that people get in the habit of doing that, especially after meals. Carb counting can also help you with meal planning. Our traditional foods, we can add it different variety and make sure that we are flexible when we are making our meals. Next slide, please. Great. I'm going to take a break here and actually have Suman take over because she is going to put this all in context of you, explaining to you what carbs are, what healthy meal planning is, and how you go ahead and make your plate and give you some tips on it. So Suman, over to you now.
Thank you very much, Anju. That was a great insight into carbohydrates and carbohydrate counting and why it is important for anyone living with diabetes. It's time for some healthy meal planning, and we are going to plan a lot of meals today. And I'm sure all of you had a good meal, and I'm going to make you guys hungry again. I'm pretty sure about that. We will look at a way to plan a healthy meal using the plate method. It means learning how to make healthier choices, watching how much food you eat, and eating some foods in moderation. It's that simple. In order to plan our plate, we are going to use a 9-inch plate and make sure we fill half of our plate with non-starchy vegetables, a quarter with starchy or carb-rich veggies, and the remaining quarter with protein, which can be a meat or meat substitute. So if you look onto your left, you can see the recommended guidelines for protein intake at a meal are 1 to 2 servings of protein. Carbohydrates can be had like 2 to 4 servings of foods which are high in carbohydrates, or 2 or more servings of low carb or low calorie veggies. And lastly, don't forget to include fats, which are very important because they are good for our energy and also aid in the digestion of some vitamins. But we have to make sure we stay within the limits of 1 to 2 servings at each meal. Next slide, please. So pictures speak louder than words. So here we see a comparison between a balanced meal and an imbalanced meal. The picture on the left is of a thali representing all the food groups with suggested guidelines and which can help you stay within the range of carbohydrate balance. And then if you look at the picture on the other side, you will clearly see that the thali has only 3 food groups, and definitely it depicts a carbohydrate overload. So finally, it's all up to us, the choices that we make. You can choose to have a plate with all the food groups by making healthy choices and staying within the range, or you can have a carb overload and mess up the numbers, which we don't want to do. So make sure that you take a note of all the labels that we have placed on the thali on the left, which are, which clearly tell us about what are the recommended guidelines for the carbohydrate intake, the protein, the veggies, the vegetables, which give us not only the phytonutrients, but also the fiber. And then also we make sure that, we stay within the range. Next slide, please. Here we have is a picture of a famous Indian or South Asian meal, which is definitely, a favorite among the old and young. This is actually an example of a breakfast, lunch, or dinner option that you can have, and you can make sure, by making a few changes, how you can make sure to stay within the range. But as you can see, if you are consuming 3 small idlis, which equal to 45 grams of carbs, a half a cup of sambar, which is 15 grams of carbohydrates, and 2 tablespoons of coconut chutney, that comes up to 30 grams of carbohydrates, we are having a total carbohydrate of 90 grams at this meal, which is equivalent to 6 servings of carbs. And definitely it's not recommended for a person living with diabetes. Next slide, please. So what is the need to, the purpose of the previous slide was basically to give you an idea how a carbohydrate overload can actually spike up, the numbers. So here we have a meal planning or a carbohydrate guideline recommended by the American Diabetes Association. So we recommend you to consult a registered dietitian for an individualized diet plan, where you can actually work with a registered dietitian to come up with numbers that that can help you stay keep your glucose numbers low. So please take a look at the table we have here, where we can learn about the recommended guidelines, carbohydrate guidelines for men and women. On the left, you will see that men generally need about 4 to 5 carbohydrate choices, or 75 grams of carbohydrate choices at each meal. For breakfast, they can, breakfast or lunch, they can actually have like 45 to 60 grams of carbs. At lunch, 60 to 75 grams. At dinner, again, 60 to 75 grams. Whereas a snack can be between 15 to 30 grams of carbs. And if you look onto your right, you will see for women, the guidelines that are provided are carbohydrate choices of 3 to 4 carbohydrates. And for breakfast, they can have up to 30 to 45 grams of carbs. At lunch, 40 to 60 grams. At dinner, the same, 45 to 60 grams. And then a snack can be between 15 to 30 grams of carbohydrates. Next slide, please. So if you recall, in the earlier slide where we had the picture of the famous South Asian meal, the idli, sambar, and chutney, we did talk about how, having 3 idlis at a meal increase the number of carbohydrate choices. So here we are talking again, like referring back to that, here we are going to tell you how we can, by swapping the chutney with a salad on the side, can help you stay within the range of the guideline provided. Like if for women who can consume 45 to 60 grams of carbohydrates at the meal, can swap the chutney with a bowl of salad, and that will actually help them stay within the range. So you can see the 2 small idlis, which equal to 30 grams, half cup of sambar is 15 grams, and then a salad will only add up to 5 grams of carbohydrates to their meal and will definitely help them stay within the range. And the same goes for men, like they can have 3 small idlis, half a cup of sambar, which is 15 grams, and then the salad only adds up 5 grams. So it still helps them stay up to like in the limit of 70 grams or 4.5 servings of carbs. So the question here is to do or not to do, that is to stay with the chutney or swap it with a salad, which actually will pack in a lot of phytonutrients, helping you with a lot of other functions in your body. Next slide, please. And we have, so now that we have spoken about carbohydrates and staying within the guidelines, we will move on by looking at a lot of examples. So I'm going to bring in a lot of yummy food pictures, and I'm pretty sure I'm going to make every one of you hungry. If you haven't had a meal earlier, I'm pretty sure you will go grab one after the session ends. So here we have a breakfast or a snack option of poha, which is one of my favorites. And here, as you can see, if you are going for poha as a breakfast or a snack option, you can take up like 1.5 cup of poha, or 45, which is 45 grams of carbs, with 1/4 cup of potatoes, which is only 7.5 grams of carbohydrates, and add to that a 1/4 cup of peas, which again equals to 7.5 grams. So which totals up to only 60 grams of carbohydrates. And I'm definitely sure that if you are going to add a few more veggies to this meal, it will make it more wholesome, and you will be still full, and you can still keep, stay within the range of the guidelines. Next slide, please. And who says puri and chole cannot be consumed by diabetes or a diabetic? Definitely, you can still eat puri and chole, but here what comes into the picture is moderation. Moderation is the key for any meal that you plan. So if you want to have a healthy meal and you want to plan a healthy meal and stay within the range, it's better you make sure that you follow the guidelines. So here we have puri and chole, which is like 2 puris equaling to 15 grams and half cup chickpeas, which are only 15 grams again. And that gives you like a total of 30 grams. And I'm pretty sure you're not just going to satisfy your hunger, but you're also going to satisfy your craving for a tasty, delicious snack there. Next slide, please. Another lunch or dinner suggestion to stay within the range. This is perfect for women who can consume 45 to 60 grams of carbs at a meal. Dal, roti, sabzi, the favorite among a lot of South Asians, and definitely a very healthy meal, which, as you can see, 2 plain rotis, 30 grams, half cup dal, 15 grams, and non-starchy vegetables is up to 5 grams. With a non-starchy salad added, which only adds up 55 grams, and we are still at 55 grams of carbohydrates, and we are still not breaking any rules here. Next slide, please. Wow, pav bhaji. Who doesn't love pav bhaji? I'm pretty sure a lot of us consume this on a regular basis, which is a go-to comfort meal for a lot of us. And pav bhaji can also be enjoyed by people by living with diabetes, by making sure that you have 2 pavs, or we can go up to 2 pavs or 30 grams of per serving. I'm sorry, or 2 servings, and 1 cup bhaji, which equals to 15 grams. So here you are still in the range. Next slide, please. So desserts. Desserts are something, the good news, like I have here for all of us, is if you are living with diabetes, you don't have to give up on your desserts by making a little more changes here and there. Like you just, so suppose if you are going to eat a 1 cup of kheer, which equals to 60 grams of carbohydrates for a snack or a dessert choice, you are definitely going to go out of the range, because remember our suggested range was 15 to 30 grams of carbs for a snack. So if you want to stay in the guideline, or within the guideline, I would suggest you swap it off with 2 gulab jamuns, which are again still yummy and which will help you stay within 30 grams of carbohydrates. Next slide, please. So here we are going to show you some more snack choices. Like, this is food for thought for all of us. We can definitely use these tips to make some changes and add some more recipes to our list. So here we have a fruit and almond milk smoothie, which definitely looks delicious. And it's a cup of original almond milk, which only gives you like 5 grams of carbs, a cup of frozen strawberries and peaches, and a 3.5 ounce berry Chobani Champions Greek yogurt packs in only 12 grams of carbs. So we are good to go with this snack. Next slide, please. Another snack choice, a very healthy snack choice, is half cup hummus with celery or carrots, which are again total of 21 grams of carbs. Lastly, next slide, please. Lastly, the favorite among, again, a lot of people is popcorn. Popcorn is, again, a favorite snack. I'm sure a lot of us enjoy it while watching all our favorite movies. So we are going to talk about popcorn here, which will be only, we can go up to 3 cups of light popcorn, and you can indulge in it. You don't have to think about, think too much on it or worry too much about whether you can eat it or not. You can definitely eat it. Eat up to 3 cups of light popcorn, which equals to 19 grams of carbs. So we have definitely spoken about a lot of food here, and I'm pretty sure we have given you a lot of food choices and also a lot of tips to help you manage your meal planning, which is, I'm sure, definitely a tough task for a lot of people living with diabetes. Hopefully you enjoyed this section of the presentation today. I would pass it on to our experts, who are going to definitely be happy to answer all your questions. Good luck. Thank you.
Hey, Suman, definitely those slides, even though I had a little lunch, I think I'm getting a little more hungry. But thank you for providing those guidelines. And now we will take a few questions. I see we have questions here. The one I see that we are going to go ahead and take is from line Varsha Nayak. How many calories are recommended for a person having diabetes? So I'm going to have Dr. Shalja. Shalja, want to go ahead? I see you smiling.
Yes. So the way that we are helping people living with diabetes is now not counting calories, because it gets tedious and confusing and complicated. There are a lot of apps where you can count calories if you want, but the better way to do it for a person living with diabetes is what Suman and Anju shared today with counting carbs. So that is much easier, where if you meet with a registered dietitian, they're going to give you your carb quota, and you can just look at the food labels and you can count your total carbohydrates, and that should help you with your blood sugar. Anju, I can't hear you.
Sorry about that. Thank you. One more question I see from Naturally Neha. How regularly should I check my blood sugar levels? I am diabetic.
Okay, Neha, that is an instruction that will come to you from your healthcare provider. So it depends on how well managed your blood sugar is. It varies depending on what your HbA1c numbers are and what medications you are on. So definitely, I cannot give you do it 2 times, 3 times, but what has been helpful is you should have a pattern of blood sugar numbers when you go to your doctor. So get a few fasting numbers. You should get your 2 hours after breakfast, lunch, and dinner. You don't have to do them all the same day, but if you take that to your doctor, they get a better idea to help you decide, where you need help. So hope that's helpful.
Okay. Thank you. One more from Tommy Grant. 0 carbs, earth balance. Can you use that on popcorn?
Yes, Tommy, you can use earth balance. You can actually use a little bit of the real fat also. There's, a little bit of fat is allowed. Fat has a function, in fact, many functions in our body. So don't just remove all kinds of fat, because they do have some important functions.
Okay, great. If you have more questions, we encourage you to just use the comments box. Otherwise, we can
I see one last question, Anju.
Yeah,
The question is about metformin, whether it has side effects. So there are known GI side effects with metformin. So especially when you get started, you could have diarrhea, lose motions, but they do seem to resolve with time. It's the time that your body takes to get used to these medications. And if you have attended our session, Dr. Datta kind of went over what really metformin was doing, and that is the reason that we have these side effects. So I hope that's helpful.
I would also advise you to discuss this with your healthcare provider, though, because individuals living with diabetes may have other conditions. And so, if there are kidney issues, there may be other medications that may have to be used. So, definitely, this is something that should be brought up with your healthcare provider and discussed.
Okay. With that, I don't know if we can move on. I do want to thank you, my peer partners from Rutgers and Suman. I think this was really hounding the message that we wanted to bring on. Today, hopefully it's helping one notch up, raising that awareness. You guys do amazing job, and thank you for having us on your team.
Thank you. It was a pleasure, Anju.
Thank you.
Thank you. It was an honor to be presenting here.
Thank you, everyone.
Thanks.
Thank you.
So just like we took some, we went deep dive into the South Asian cuisines, we intended to bring a lineup of some other cuisines to be followed. Unfortunately, due to some personal reasons, the presenter for that segment, Lion Lydia Petrov-Jones, is unable to join us, but I'm going to have Lion Mahesh say a few words about that program and what Lydia has to share.
Thank you, Anju. It was a great session. We got a lot of information about the way that the diabetes can be managed, specifically targeting to the South Asian population. We do understand that we have the attendance from over 40 countries and very diverse backgrounds. And it was our intention to bring in various aspects of nutrition and the other cultural aspect that deal with the lifestyle in general, specifically about the people with diabetes. We had a very good expert, Lion Lydia Petrov-Jones. She was supposed to be here. Unfortunately, she couldn't come in today. She was supposed to talk about the culture of food, the nutrition for the Latin Americans as well as French and Italians. She apologized for not attending today, and she will be preparing a document. If you can register your attendance, and if you are interested, we would send you those documents, and we will surely set up a session with Lion Lydia at a future date. Having said that, even Shailja alluded to that, and one of the major things that Lion Lydia does is these peer groups, creating the support groups, and we would talk about that at a later part in the session in the day. But we would work on creating an in-person group along with the Rutgers support that we have, Shailja and Dr. Suchi and everybody at Rutgers. We'll surely work on getting some support groups, as well as we would work on having the virtual groups at a future date. Not as in future, as in not in too much in future, but we will try to do it in near future. One of the things that I just wanted to share, which Lion Lydia wanted to share with you, I'm just going to bring up one of the flyer that, not a flyer, the workbook that Lydia wanted to share. The Lions of South California have created a program called Nudge Away Diabetes. And this program is basically a workbook which for the support groups. I'm just going to scroll through so that you can see a little bit more information. Lion Lydia, besides being an aviation engineer, she, as a Lion, she runs a Lions Diabetes Camp for children and youth. And she has worked on with her colleagues and the Lions in California on this workbook. It is a workbook that is available on a variety of media, including the digital media as well as print media. Right now, during the pandemic, they do have these sessions online. So I would surely encourage you to put your attendance in the attendance form so that Lydia can communicate with you in near future, and we can sort of help the people with who follow the different diet than South Asian diet. So thank you so much, Anju. Back to you.
Okay, great. Thank you for sharing that information. We do look forward to learning more about other cuisines as well, because this is all about awareness and, you know, raising our education as it relates to diabetes. Next, I just wanted to move along. Do we have Dr. Mike Castellano available? I know he was.
He was on the call. Whenever he gets in, we will get him in.
Sure.
But right now,
so let me move on. Sure. Let me move on next to introduce PID Bruce Beck to talk about Lions Stride Walk. Bruce Beck is from Palisades, Minnesota, USA. He was elected to serve a 2-year term director of Lions Club International at the association's 99th International Convention held in Fukuoka, Japan. Sorry if I misspelled that, misstated that. June 24 through 28, 2016. Director Beck is a retired law enforcement administrator, a member of the Palisade Area Lions Club since 1989. He has held many offices within the association, including club membership chairperson, district extension chairperson, zone chairperson, district governor, council chairperson, district GLT coordinator, and multiple district GLT coordinator. He was also a presenter at the 2014 USA-Canada Forum. In recognition of his service to the association, he has received numerous awards, including the Membership Key Award, Leadership Award, Extension Award, Zone Chairperson Excellence Award, 4 International Presidents Certificates of Appreciation, and an International President's Award. He's also a Melvin Jones Fellow. In addition to his Lions activities, Director Beck has been active in numerous professional and community organizations, including Chief of Palisade Fire Department, President of the Minnesota Fraud Investigators Association, and Councilman for the Palisade City. Director Beck and his wife, Erin, also a Lion and a Melvin Jones Fellow, have 2 beautiful daughters. And there we go. Next to you, PID Bruce Beck, please.
Greetings, Lions. Namaste. And thank you. I am so pleased to be with you today. And as we talk about doing a Lions Club International Strides Walk for diabetes awareness. So if a club or district is looking at putting on a Strides Walk service activity, typically in my club, we have done this for over 10 years. It is an annual event that we've worked on. And so our committee usually gets together 3 to 4 months ahead of time. And we want to get the planning so that we're all organized and ready on the day of the event. We decided the first year that we wanted to make this an annual event because diabetes was very important for our club. And in doing so, I want to encourage you, if you want to do it more than one time, pick the weekend that you can do year after year after year, because once people know, it's always for us, it's the first weekend in August, and people know that and save it on their calendar in their planning, which is very helpful for getting returns. We use a city street. It could be on a designated hiking trail or in a arboretum area that's beautiful or scenic to look at. In the photograph you see, in the picture of the Mississippi River, we walk up the road that parallels the Mississippi River, and it's just a beautiful scenic walk. On the next slide, the day of the event, we get everyone to sign in and register. We have a registration table. We charge them $20 or $25 to participate because they know it's a fundraiser. But we also ask their shirt size, so they get a t-shirt promoting the Strides Walk, and we put the year. What we've discovered is many walkers who return collect those, and they want a new shirt each year showing that they walked. I want to encourage you to take lots of photos, not only of your club members, but of the participants, and show them having fun, because you can use those in promoting what a successful event you had. You can use it for marketing the next year, showing everyone what a great time they had. And what I have learned about Lions and Fun, you see the back of our t-shirt, that was our 10th anniversary year. That's the old guys celebrating. I'm one of the old guys there. We take a group photo showing people energized and pumped up about getting ready to go out on the walk. Just shows some of the youth. We get many youth engaged. They're energetic, they're excited, and they always bring an additional fun dimension to the event. And I encourage you to get the youth to come and participate in your walk. Our event is always held rain or shine, and the attendees know that. And so whether they have a rain poncho or whatever, so far we have never been rained out. Well, I hope our luck continues. As the walk is completed, please, what I should have started with is when the race starts, have somebody with the stopwatch or a timer to start when they begin. And the reason we do this is because some of our attendees are very competitive and they want to run the Strides Walk event. It's a Strides Run Walk. And the runners are very, very competitive. And so we always keep track of the top 3 finishers, and they want to know their time because it's a matter of honor, I believe. And so they want to know how quickly they completed the event. So if you have a timer that will do the start and the completion times of at least the top 3 or 5 competitors, the attendees, that would be very helpful. When they do complete, always have fresh water available, bottled water, and fresh cut fruit. We have watermelons and other melon slices cut up and easy to eat with the fingers. And we be sure to thank them and congratulate them for competing. And we always remind them we look forward to having you back next year, because and we have many attendees who come every year. They believe in supporting diabetes, and this is one thing that they choose to do to help and make it look good. People rarely succeed unless they have fun in what they are doing. And I am convinced of that in any Lions activity, but even more so with the Strides Walk. If they're having fun, they will come back. It's a powerful tool to help you raise funds. It's a healthy activity, not only for your membership, but for your community, and it's promoting a healthy lifestyle and diabetes awareness. I strongly encourage you to consider it or think about it as one of your club service activities. Plus, you can raise some funds for the Diabetes Fund at LCI.
Now, that was wonderful. Now let's move on to see what our Lions in Nairobi are doing to support our community.
My name is William Karanja Wakabi. I'm a small-scale farmer. I have lived in Nairobi for the last 55 years. I went in to feed the goats, and then a nail had gone into my feet. I didn't feel any pain at all. I didn't know much about diabetes, but I won't imagine losing the whole foot.
There's been a lot of emphasis on conditions such as HIV and TB. Diabetes and hypertension have been largely ignored.
People are not aware that diabetes is a serious issue.
The type of healthcare that you get is not adequate. The doctors are not very well trained. Problems are misdiagnosed.
Type 2 is the only type of diabetes that you can actually reverse through lifestyle changes. Through our initiatives by creating awareness, focusing on education, Lions Club International members worldwide can make an impact.
Now, in your family, who has diabetes?
Four. I have diabetes past 6 months, so I wanted to know more about it.
When a patient comes in to a multidisciplinary diabetic center, we have a team of over 20 different medical specialists to deal with that diabetic and their complications.
Look down.
They will have their eyes checked, be checked for any neuropathic complications, be given a consult with the endocrinologist to check the sugar control. Then they will see the nutritionist as well. We then educate the families.
The aim is to try and increase access to medicines, access to trained doctors in diabetes.
We make these services affordable to everybody. And that is what Lions is about.
Through the outreach camps, we can direct any patients that we find to the Lions Diabetes Care Centers.
But even more importantly is a condition called pre-diabetes. By running these screening initiatives at an early stage when you can intervene, pick up these individuals, and you now educate them on simple diet and lifestyle practices. This will reverse 58% back to having normal blood sugars.
All right. That was wonderful to see how different people, all the lines are really making a difference. Thank you for sharing that. Now, next with us, we have Lion Dr. Mike Castellano. He is a wound care surgeon affiliated with NYU. He's a member of Jericho-Prouville Lions District 20K2 New York. Dr. Castillo has taken a few minutes of his very busy work schedule today to be with us. So I won't take too much time and just have him come say a few words to us. Thank you for joining us.
Yes, hello. I'm enjoying your presentation. It's really been outstanding. I've learned a lot of stuff too. Unfortunately, we are very busy. And I say unfortunately because that means not enough people are managing their sugars well, getting the outside help they need, or taking advantage of some of the outside help and support that's out there for people with diabetes. Diabetes is a scourge, really, that affects so many different people, and I see it on the worst end of it. I'm going to use a cliche that I'm not trying to sound funny because it's not, but if you are seeing me, then things went wrong, and you don't want to see me. You want to stay away from me. I'm a wound care surgeon, and I'm a general surgeon by trade. Went into wound care and hyperbaric medicine, which go hand in hand with diabetics. The reason I don't do as much general surgery anymore, again, is because it's unfortunate that we were just so busy, and we cross all socioeconomic levels and ethnic backgrounds, and we just see diabetes is really like a pandemic, basically. It's terrible. Let me start off with saying that if you follow all the directions that I heard today and you're really careful and your sugar maintains good levels, normal levels, then any surgical procedure you have, regardless of what it is, your rate of infection or complication is no higher than anybody else's when it just comes to purely diabetes, meaning that you don't have any of the other side effects of diabetes, heart disease, kidney disease, etc. So maintaining that blood sugar is incredibly important. Now, I'm sure some of this has been discussed, but really quickly, so what happens? The diabetes affects the very tiny vessels of the body first, the microcirculation, and it affects everything: the skin level, the kidney level, the eyes, the heart, the brain. And that's why we see people on kidneys who have diabetes, especially when it's uncontrolled for a long period of time, with things like dialysis, strokes, heart disease, diabetic foot ulcers, infections. So why is that? It prevents nutrients and oxygen when the sugar is high from the cells. It prevents your immune system from functioning efficiently. So the cells, we almost say, are sluggish, almost like drunk. The white cells are slow to move to infection. And then your inflammatory condition of your body is actually raised. So you have more of an inflammatory reaction, more than you need. And so you develop a much worse reaction to even the simpler infections. And it's sort of a double-edged sword. You're higher risk for infection, which then raises your sugar, which makes your immune system worse, which makes sort of a path where then your infection becomes worse. And so this is why we see severe diseases such as cellulitis, things that we discussed. It's called necrotizing fasciitis, people with abscesses, and then the diabetic foot, which I'll discuss separately a little bit. So what are some of these things? Cellulitis is an infection of the skin. Usually we see it on the legs. It can happen from a small opening of the skin somewhere. The skin is your protection. You need to maintain it. And that usually requires IV antibiotics to take care of, and skin care and wound care for the foot if there's a small opening. The next is an abscess. You know what an abscess is? We call it a boil, or it's a collection of an infection on the skin that has pus in it and can lead to a bigger infection. So it usually needs to be drained with or without antibiotics. And then there's something we call necrotizing fasciitis. Now, what that is an infection that starts off in the skin, and because of the poor healing of the poor healing system of the patient with the high uncontrolled diabetes and high sugar levels, the infection gets to a certain level just above the covering of your muscles. And in that space, that's a space we call it a potential space. It's not there until something in there gets in there, makes it a space. So what happens? The bacteria gets in there. They make a little bit of gas. They open that space up, and the bacteria can run rampant. And then it gets confused, but it's similar to what we call the flesh-eating bacteria. And unfortunately, I do see that, and it's life-threatening. And we're much better at treating it, but it requires using many, many surgical procedures and long-term care. So the third thing I want to speak to you about would be the diabetic foot. Why do people get diabetic foot? So 3 reasons. They have the poor healing, like I said. They have microcirculation damaging. So the microcirculation to the foot and to the nerves affects 2 things: the ability of the blood to get to your toes and feet, and also affects your nerves. So then you lose sensation. So now you have a numb foot, a foot without feeling, or sometimes people have extraordinarily painful feet, but they're not feeling the actual injury to your foot. It's very strange, and it can be very debilitating. And you walk without shoes, and then you cut yourself with a small little puncture, or just irritation, friction, you develop a callus. Callus for a diabetic is almost an emergency. I mean, you don't go in the middle of the night to the emergency room, but you do not say, just a callus, I'm going to sit home. A callus is something that is extraordinarily dangerous to a diabetic. And why is that? Callus is a reaction to a pressure or a friction that is occurring deeper to your tissue, and it's a reaction on the outside that you're seeing. Many times a callus, the wound is already down deep into your tissue, almost near your bone, and it can lead to other things I'm going to discuss again in a second. So what happens then? Then you have an infection that your body can't fight because it doesn't have the circulation. You're not feeling any pain, so you're not even noticing it. Some people don't notice forever. And then the infection becomes extraordinarily extensive and severe, and it leads to either this necrotizing type of infection, a bone infection, which is called osteomyelitis, or a limb-threatening rampant infection called gangrene, requiring amputations. Now, the number 1 cause of amputation, unfortunately, in this country, is uncontrolled diabetes along mixed with vascular disease, because they do go hand in hand. And here's the problem with that. I mean, that's horrible to get an amputation. Believe me, we try everything. We're a limb salvage organization at NYU. We do everything to save people's limbs, toes, whatever we can do if we can. But I'll discuss it to you when we can, what we do. But the problem is when you get an amputation, when you get to that point where your body's been injured through diabetes, your 5-year survival, believe it or not, is lower than people who have colon and breast cancer. It's a first step into a very bad pathway, unless people can really change and you know, some of the things can be done to reverse some of the damage. So we really never want to get to that point. And that's why the other lectures were so important. And the other thing that for me is prevention, meaning you get foot care. You see your podiatrist, you go to your doctor. If you go into your doctor and they know you're diabetic and someone's not looking at your feet every time you're been seen by a doctor, get a new doctor, because that's one of the most important things. Somebody has to look at your feet. You can't do it yourself. Sometimes you can, but really you can't, because you can't see everywhere. You're not feeling it. Someone has to check your pulses. Someone has to look at the skin. Someone has to look for any abrasions. That's what we do when we have patients come in our office. We look at their feet. We look at, even if they come in with a wound on their ankle, we take a look at their feet, see if there's any callus formation. Like I told you, callus is a sign, can be very bad, or at least the beginning of something bad. And the circulation is very important. I mean, see if you have neuropathy. So again, your doctor, if you want to see a doctor and they're doing what's called the physical on you, and no one's telling you to take your shoes and socks off, and you're diabetic, then you really need to find a new doctor. That's a bad practice. So then what happens? So now you have so unfortunately you get an ulceration, you go see the doctor, and then what do you do? There's a workup. We have to check your circulation, some very non-invasive testing. We usually have to do an X-ray. We do a neurological test to see if you have neuropathy, and then we try to diagnose what you have, making sure you don't have a bone infection. Bone infection is called osteomyelitis. Osteomyelitis is one of the leading causes for the amputations. And also the bone marrow, the bacteria get into the bone marrow. The bone marrow is a very low pressure system, and the bacteria gets in there, and it can immediately get into your body and cause what we call sepsis. And that's a life-threatening infection. So we want to always try to avoid that. You need IV antibiotics, sometimes broad spectrum, sometimes you have to come in the hospital. And then we do things like offloading. We get you shoes. We find the special boots to put you on. There's orthotics. There's some people there's casting. Some people do in their offices. Anything to relieve the pressure, because most of the time these are generated by pressure. So then that usually takes several weeks to see if that heals. If it doesn't heal, we have other options. There's sometimes debridement, sometimes there's limited amputations, sometimes there's foot. We send you to the foot specialist of podiatry. I don't do these operations where they repair the deformity that's caused by diabetes. Diabetic also feet tend to have claw toes, and they lose their arch, and then they develop pressure along their balls of their feet. Sometimes their ankles, something called a Charcot joint, where you're basically spraining your leg all the time, your ankle. You don't know it, and you're destroying all the tendons, and your ankle basically becomes useless, and you start walking on your like the inside of your foot, and you develop ulcerations there, or some other ulceration on your heel. And those also have to be either repaired with ankle foot reconstructions, or special boots and shoes that can help prevent these problems. Now, once we get control of the infection, or we get control of the wound surgically, we have something called hyperbaric medicine. That's a chamber that you go into, and it pumps in 100% oxygen under pressure, like atmospheric pressure. We call it a dive because it simulates going underwater, about 2 atmospheres or 36 feet, depending on 32 feet, depending on what kind of atmospheres you need. And that pushes oxygen into your tissues and into your bloodstream, not into your hemoglobin, because that's already saturated, but actually into the non-hemoglobin part of your body. In fact, there was a study done very early on with hyperbarics. They took all the blood out of a dog and put only salt water, and they put them in the hyperbaric, and they were able to live as long as they were in the hyperbaric, because enough oxygen was being pushed into the saline. And so what does that do? Diabetes is what I told you before, is a lack of oxygen to the tissues for many reasons. Transfer of energy, slow circulation, diminished circulation. So this helps avoid circumvent that a little bit and pushes the oxygen into the tissues and into the area that we want, either the bone or the wound, to stimulate the healing. It also lowers the inflammatory response. Now, this is very, for a talk to talk about inflammation is very difficult, because you always want inflammation to occur for healing, but then when you get too much inflammation, it deters healing or causes problems. And this may be one of the reasons, just as a side note, that maybe the COVID affects diabetics more, because their regulation of their inflammatory system is hypercharged, and they get a super reaction to this virus, and they don't do well. That's one of the theories. Again, maintaining the sugar, I'm going to say it again because that's the key. Maintaining sugar over a long period of time, hemoglobin A1C and your glucose, is what helps prevent many of these. It's not 100%. There are people who control well and still have complications, especially the type 1s. But to avoid the things that I'm mentioning to you is what is by maintaining your glucose. So once we do the hyperbaric, and we have other things, we have skin grafting from your body. We have skin that's grown in the lab from a cell originally, and now it's grown into the lab. It's a living cell, not your skin, but a living cell. We also have cadaver skin. We have tissue substitutes called amniotic products made from the placenta. We have umbilical cord products made from obviously the umbilical cord. These are all almost like, make it simplify, it's almost like a stem cell that can go in and stimulate, because they're from the placenta, help stimulate and push your tissue to grow and to heal. There's different types of cell grafts. There's one that you can take from your thigh. There's one with little blisters that we use that are less invasive. But what we need to do is our whole two options. Our two main goals: get this to heal, not come back. Also to get that skin closed as soon as possible, because your skin, as I mentioned earlier, is the one barrier you have against these very severe infections, sepsis and gangrene. And this is my job basically is not to let someone die from those, because I'm the general surgeon on call. The rest of the wound care and the grafting and stuff can be done by anybody, but my main goal is to, when someone comes in with potential life-threatening infections, that I get them to the operating room right away and treat them. I don't have any slides for you, I'm sorry, but I appreciate you listening. I hope I gave you some insight on what, again, the unfortunate part is if you're diabetic and you come into the wound center, at least you'll know what to expect, and that under the proper treatment, we save a lot of limbs and go back and functioning very quickly. Thank you.
Thank you. We definitely appreciate you coming on board and giving us this different aspect of diabetes. It's very close to me. I personally have my mom suffering with diabetes for a long time, and I think it became real. And I personally can relate to a lot of the information you shared. So thank you for making the difference in what you do. Next on, I don't know if you have any questions that you have a few minutes to take, or should I couldn't see the comment box. Mahesh, do we have any questions that we want to?
No, I don't see any questions so far. Being a diabetic myself, I know that people want to stay away from this thoughts that they have to deal with the wounds, but it is very, very important, as Dr. Mike said, that we need to be careful about that. And we do love to have doctors. I would love to go and meet Dr. Mike, but not in his office. I would want to meet him in his club. Like we don't see any so far.
Thank you.
Good.
Thank you so much, Doctor.
All right. We'll go ahead and move on. Next.
There is one question.
Yeah.
I'm sorry. It is on the screen. Oh, but we lost Dr. Mike in the process.
Sorry for the delay on my part.
That's okay.
We'll come back to you on that. Next, moving along, we have on the schedule DG Semi McCall. I believe is not able to join, but we do have a video. And the message that I have from you, Lion Mahesh, is telling me that DG Semi was in your district governor-elect training class, and you're very, very proud of him. So I can't wait to hear more and learn from DG Semi McCall.
Greeting Lions all over the world. Lions Club International Foundation has initiated Campaign 100 to deal with 5 causes affecting humanity: diabetes, childhood cancer, the environment, hunger, and vision. Lions Club International Foundation, in cooperation with the World Diabetes Organization, formed a treaty in 2017 to deal with the diabetes pandemic. We were fortunate in the state of Michigan to receive over $250,000 for DAD, and our 11D2 we received $22,000. The Lions of Croswell, in partnership with the City of Croswell Community Health and Fitness Center, established the Community Diabetes Center, located in the city of Croswell. It's run by volunteers from the Lions Club and the community. It will be staffed by certified nurses and diabetes educators. It will service the people within the community, regardless of income or residence. It will teach about nutrition, exercise, mental attitude, and knowing the medications. The ribbon cutting is August 11, 2020. Thank you, LCIF and the Lions of Croswell, for a great project that will be a world model to follow. Thanks for the privilege of your time. District Governor Dr. Sami McCool, 11D2, Michigan.
We looked at what was happening in our community right now, and in talking with our local pharmacist, he is servicing 750 or more people with insulin alone. And that doesn't count the oral medications or other medications that people would be using in our small town.
So we have a great need. We're in a rural area, and we have over 2,000 people who live just in Croswell. But when we look at the region around us, there's around 8,000 or 9,000 people. Of that, over 50% are either pre-diabetic or diabetic. So the need to teach so that people don't become diabetic is very important.
It really started with Lions Clubs International trying to prevent diabetes and its complications as one of their big projects. And I knew that we had a lot of people in our town that were fighting diabetes. They didn't want to travel distances to get services. And so I talked to our Croswell Lions Club, and we decided we wanted to do something in our own community to help the people in our community. So we wanted to bring services to them.
What we hope to achieve is to have people learn about being healthy at a young age all the way to their older age. And sometimes diabetes runs in a family, however, we don't prevent it. And so what we want to do is to prevent someone from getting diabetes. So if mom or dad have diabetes, the children need to know how not to get diabetes. Although diabetes is not genetic, there's a lot of lifestyle changes that have to occur to prevent diabetes from happening. So our intention is to educate the community, educate family members, educate everyone to show that diabetes is an important diagnosis. It's an important way to be healthy, to not have it, and we hope to eradicate maybe some diabetes in the future by having the educational center. We are hoping to really gather families in the community and out of the community. Our intention is to provide services related to education of diabetes, why we need to prevent it so that we don't become people that have amputations as a result of diabetes or have strokes as a result of diabetes. One important component, I think, of our educational center is support. So we hope to develop some support groups where people can come, family members can come, or children can come and talk about what it's like to live with diabetes.
Anyone who is wanting more education, you do not have to be diagnosed with diabetes or pre-diabetes. You might have someone in your family who has diabetes and you want to be able to help that person. So we would provide services to you for that. Anyone in our community, not just in the town of Croswell, but we're looking at a whole community going to our surrounding towns as well. We decided the best way to do that was to have a center where we could provide services with registered nurses, with diabetes educators, classes that would help with meal planning, daily living with diabetes.
Some of our classes are going to be living with diabetes, you know, what it's like to be having diabetes. Then we're going to have a class called Diabetes 101, which really talks about the changes that can occur if one has diabetes. And then we're going to have some meal planning. Then we're going to have nutrition classes. We're also going to have maybe some cooking classes so people can learn that we can change the way we cook so that our foods taste good. The other piece, we're going to have some alternate lifestyle types of projects or programs. For example, we may use aromatherapy, maybe a class that we talk about aromatherapy and diabetes. We may have classes talking about vitamins and minerals and what are the best types of vitamins to use when one has diabetes. So those classes become important because then it helps individuals when they go shopping to buy the right types of products.
Okay, our staff is composed of all volunteers. Some are Lions members, some are members from the community. They will all have an orientation that they will go through, and so that they know exactly how to handle situations in a professional way. We will be offering by appointment times when people can come if they wish to talk to a registered nurse. Or we do have one of our Lions members is a certified diabetes educator. She has had extra training in diabetes. We also have an area in our facility where anyone who wishes to become a certified diabetes educator can come and do that. It's an online course, and our own diabetes educator would be there in case there were questions or a need for tutoring for that course. Our facility is called the Community Diabetes Center. It's located at 110 North Howard, Suite number 2 in Croswell, and it's right across from the post office. We will be open during the week, during the daytime. One night a week we will also be open, and then one Saturday a month we will be open. We will be offering classes, they will be scheduled, and we are trying to offer those at times that will be convenient for the people in our community to be able to attend.
Wow, I actually love this video's message. Thank you, Croswell Lions Diabetes Center, for all the wonderful services that you are offering. Education on how to prevent and manage diabetes is the key. and a message that we want to bring out in raising awareness to fight against diabetes. Moving along our schedule, we do have Lion Ezio Bustamante, who is with us next. And he is going to be talking about, Lion Ezio is a member of the Elizabeth Cubans Lions Club with over 16 years of government experience, including 9 years of as an educator. Public service is his passion. Presently, Ezio is an instructional technology coach for Elizabeth Public Schools in New Jersey. Ezio holds both a bachelor's and a master's degree in public administration from Keene University, and he's going to be talking to us about various Lions diabetes programs around the world. So over to you, Ezio.
Good afternoon, everyone. Thank you. It's such a wonderful pleasure of mine to be part of this wonderful event and the diabetes.
I don't know if it's me. I am not able
I
to.
think he got disconnected. Just
Yes.
give me 1 second.
Okay.
All right. Am I back? I think I am.
Yes, you're back.
Thank you very much. Thank you very much for that introduction. It's such a great pleasure to be part of such a wonderful event. I do have a PowerPoint presentation. I believe Lion Mahesh is loading it up right now. And again, I want to thank everyone for allowing me to participate in this event. Diabetes is one of the 5 global causes of Lions Clubs International. Our members around the world undertake diverse projects to serve our communities. Eastern Indian Lions Leadership Academy has presented a webinar recently with a great compilation of such service project. Please visit their recording for more details. But here's a glimpse of their featured projects. Next slide, please. Now, in the next several slides, I'll go over wonderful events, diabetes screening activities and such. But I just wanted to briefly discuss that there are several specialty clubs that focus on diabetes services. There are 17 in the US, 1 in Canada, 15 in South America and Latin America, 13 in Europe, 9 Far East Asia, 120 in South Asia, 3 in Australia, and 10 in Africa. Next slide. Lions undertake diabetes screening activities during community gatherings, places of worship, senior centers. Lions of Calcutta conducted such a screening program in busy metro station in collaboration with the local hospital. Next slide, please. Lion Vinod Devasya from India developed a diabetes risk assessment app which has screened over 1 million individuals in less than 9 months. This application can be customized for your club and use as your club activity. Next slide, please. Diabetes Youth Camp in Romania is another way of prevention and public awareness. It is a week-long camp for the youth suffering from diabetes. Next slide. Lions in the US host several diabetes camps, including a successful camp in Southern California and a 25-year-old Camp Leo in Washington State. Lions of Alabama collaborated with University of Alabama football team to put together the Peace Ball to create an exercise program for healthy lifestyle for the kids suffering from diabetes. Stride walks, dance, Zumba are also created to raise awareness and funds to support diabetes research in various parts of US and the world. Our own VDG, Varsh Naik, hosts a Stride Zumba every year to support LCIF. Lion Donna Friedel and PDG Bob Friedel organized a stride walk during our state convention for the last 6 years to raise funds for JDRF. Cyber Lions Club of Ohio County hosted a 5K race on Saturday, November 14th, 2020, during the pandemic to raise funds for LCIF. To motivate community to have healthy lifestyles, Lions clubs in Australia had a project called Lap the Walk. It is for groups to walk together and record their distances. It is their ambition to reach the moon this year by walking 250,000 miles. And on the right side of the slide, you can see a map of Australia and little green pinpoints. Individuals and groups can pinpoint where they have walked and how much they've walked on their website. Next slide, please. Lions of Canada and Australia train and breed of companion diabetes alert dogs. And in Kenya, Lions of Kenya, India, and Lions of Michigan established a diabetes center, as you heard from DG Sammy. Continuing on with public awareness and support, there has been a setup of a mobile care van in India, as well as diabetes, retinopathy, and neuropathy clinics in India. Fantastic events and great way to outreach for the public and make the public aware of diabetes. Thank you, everyone.
Now I think we lost Lion Anju. So thank you so much, Lion Izio. Those were like collection of few of the Lions projects around the world, just to motivate the Lions on this call to find out activities that they can do locally to support their communities. With that, while Lion Anju is joining back up, I would have a presentation about Lions Club International Foundation and Lions Club International and their projects. Anju is back on. Anju, take over.
Thank you. So next over to Lion Emily Johnson to talk about the LCIF grants. Emily is the Region Program Specialist of Lions Club International Foundation, supporting global health initiatives. And we also have Lion Mary Campbell, who's the Program Development Specialist at the Lions Club International. They'll be explaining diabetes-related initiatives of Lions Clubs and LCIF.
Good afternoon, everyone. My name is Emily Johnson, and I am a Regional Program Specialist at Lions Clubs International Foundation.
And hi, everyone. My name is Mary Campbell, and I'm a Program Development Specialist in Service Activities here at Lions Clubs International. So today I'm going to talk about current and upcoming diabetes service activities and programs that are available to all Lions and Leos. As you know, diabetes is an epidemic that affects millions of people around the world. In fact, about 463 million people currently have diabetes, and by 2045, it is expected that this number will reach 700 million people. The good news is that our Lions and Leos recognize the need in this global cause and are doing something about it. In the past year, there have been 35,398 diabetes service activities completed that served 13,052,928 people. These are all due to Lions and Leos just like you. Through serving in diverse communities all over the world, we see and feel the effects of diabetes and are doing something about it together. Through our programs and service activities, we aim to reduce the prevalence of diabetes and improve quality of life for those diagnosed. These include strides for diabetes awareness, type 2 diabetes screenings, diabetes camps, diabetes peer support groups, and many more. Now I'm excited to share some of our diabetes programs and resources. First, we have our Strides for Diabetes Awareness program. A Strides event can be any physical activity from a run to a dance competition. Strides events are a fun and engaging way for Lions and Leos everywhere to promote diabetes awareness and help their community members prevent or delay the onset of type 2 diabetes. This program recently went through a rebrand, including the colorful new logo that you see on the right. Next, we have our Type 2 Diabetes Screenings program. A Type 2 diabetes screening is a community event that provides education, awareness, and screening services. Type 2 diabetes screenings is an important way to help individuals understand their risk and make our communities healthier. In the short term, community members learn about diabetes and their current health status. If necessary, they can also be referred for care. All of this leads to an overall improved quality of life. If you or your district are planning these events, check out the LCIF diabetes grant criteria and explore funding options. Next, we have Diabetes Camps, which is a program for youth to gather, increase their supportive network of peers, and improve their diabetes management through educational outdoor activities. Interested youth discover available camp programs through local Leo and Lions clubs. Lions and Leos can participate by volunteer hours, camperships, fundraising, or coordination and execution of camps. Camps are comprised of full-day camps, overnight camps, and international exchange camps. If you are interested in hosting a shorter event, consider hosting a half-day diabetes family event. For more information and to download the half-day diabetes family event project planner, please visit our website. Finally, we have our Diabetes Peer Support Groups program, which I'm currently developing. Diabetes peer support groups involve practical, social, and emotional support exchanged between people with shared living experiences, such as living with diabetes. By developing trusting relationships with other people who have diabetes, peers can catalyze behavioral change and help maintain these changes over time. Peer support groups provide an environment where people can feel comfortable and be themselves. Diabetes peer support groups have several Lion and Leo roles that require little medical or diabetes knowledge. During the COVID-19 pandemic, some in-person service activities may be paused or replaced with virtual alternatives for safety. Thankfully, through this difficult time, there are still many ways to make time for diabetes. Take the online diabetes risk assessment and encourage your club to determine the risk of developing type 2 diabetes. This takes less than 5 minutes and is very important. You can also plan future diabetes service activities using our Diabetes Project Ideas list. This is a great conversation starter for your club when trying to determine future diabetes service activities. You can also share facts, resources, and information about diabetes on your social media or in your virtual club meetings. For more information on diabetes facts in your area, check out our diabetes fact sheets. These fact sheets offer country-level and global diabetes statistics. You can also plan a virtual Strides event similar to the one we saw in our virtual Strides Zumba class webinar in honor of World Diabetes Day. And finally, you can start providing peer support to those you know with diabetes via phone calls or video chat. It's easy for people to feel isolated during this time, so do your part to help those around you feel a sense of community. For more information on ways to serve safely in your community, visit the Serving Safely webpage. If you have any questions or would like to learn more about the programs and resources you have seen today, please reach out to programs@lionsclubs.org. Thanks again, and I'll pass it over to Emily.
Thanks, Mary. As a way to support Lions who want to expand their service and need additional resources to make a larger impact, our foundation offers grants. Funding is available between $10,000 and $150,000 for Lions districts, and up to $250,000 for multiple districts. LCIF matches up to 75% of the total project, which means that Lions are responsible for at least 25% in local matching funds. The matching funds must be contributed as cash. While in-kind donations do not count toward the match, they can still strengthen the overall request. Grants are reviewed in August, January, and May during LCIF board meetings, and the due date is 90 days before those meetings. However, the review process can take some time depending upon the eligibility and development of the grant application, so it's always best to submit the application earlier to avoid delays. At any given time, only 2 diabetes grants can be open for a single district, and 1 diabetes grant can be open for a multiple district. Having an open diabetes grant does not affect a district or multiple district's ability to apply for other LCF grant programs, so long as the active diabetes grant is in good standing. Additionally, grants must be submitted by the local Lions district or multiple district, and Lions are also the recipient of the grant award. Healthcare or community organizations are not eligible to apply for a grant without the involvement of Lions. So what types of projects are eligible for a diabetes grant? LCF diabetes grants provide support for 4 specific intervention areas. One supported area is youth camps and retreats that encourage interaction and education amongst peers. Another intervention area is human resource training to establish or expand professional level medical expertise or train community diabetes educators. Diabetes grants also fund infrastructure development to improve diabetes healthcare access through renovation of diabetes care and education facilities, as well as the provision of equipment. And the final intervention area is community screening activities organized in partnership with healthcare professionals that are designed to identify at-risk individuals. Screening activities must also ensure that there is a follow-up care protocol in place. Eligible and ineligible expenses within these intervention areas are outlined in detail in the diabetes grant application, which can be found on our website. I'd like to quickly share an example of a diabetes grant. Lions in Kentucky received a grant to conduct a multi-year community diabetes screening, education, and training project. And through the Bluegrass Lions Diabetes Project, over 3,000 individuals are being screened for prediabetes, diabetes, and diabetic retinopathy, and referred into DPP and DSMES programs. For more information on diabetes grants, you can send us an email or visit our website. Whether you're interested in a diabetes grant or another LCF grant program, I highly encourage you to check out the new grants toolkit on our website. It includes resources such as tips for applying for a grant, application forms, and much more. Thank you.
Okay, Lion Mahesh, if you can play the next video to be followed now.
Yeah, we had a few minutes, so I thought this is one video that can, again, represent one of the club projects. The Lions of Alabama worked with the Peach Ball, their football team, to promote the healthy habits among the children. And here we go.
Pound is a Pilates-based workout.
So it's kind of like a jam session. You just gotta kind of rock out to your favorite songs while you work out.
And we also get to work out using like drumsticks.
Lions Clubs International has partnered with the football team here at the University of Alabama, the Peach Bowl, and the school system here in Tuscaloosa to promote defeating diabetes by living healthy lifestyles.
I was diagnosed with type 1 diabetes when I was 9 years old. Thought my life was over, thought sports was over for me. But as you can see, I'm still living out my dreams, playing football and baseball at the University of Alabama.
It's always a great time to connect with students and teach them how to exercise because that'll just lead to a healthier lifestyle.
I want to tell y'all what exactly diabetes is. We're seeing a rise in type 2 diabetes in children, mostly because we're seeing a rise in obesity, and that has mostly to do with the kids are not getting the exercise outside of school that they need.
Going outside and playing 30 minutes a day or more, that's very important. Limiting that screen time to an hour, maybe a day, that's really important because we want kids to be up and moving more.
It's an opportunity for us to share with the community that with proper education, good food choices, medication management, that they can still have productive lives.
I just want to give a message to all the kids that have diabetes. Keep living, control your blood sugars. You can do anything. Don't let this stop you.
It definitely inspires me because, I've had family members who've had it, so I know that it's important for me to do its best to take care of myself.
If we focus on eating healthy and working out right now while we're still young, we can help ourselves in the future.
Our goal as Lions is to improve the quality of life for all of those who have diabetes.
Great. That was wonderful. Thank you again for sharing that. And with that, I hate to say we're feeling sad that it's coming to an end for today's agenda. But before we move over to the closing remarks, I would say through this first virtual diabetes symposium, our goal was to bring in experts on various topics to help you raise awareness. And our goal is hopefully with the education that you have gained, even if it's one point that you can take along with you and make a difference in your lifestyle and how you manage your diabetes or your loved ones, our mission would have been accomplished for this symposium. So over to you, Lions Mahesh, and I do want to thank you for your leadership, guidance, and bringing it all together to help me execute on this for this weekend.
Thank you so much, Lion and Ju, for all your hard work and effort. This turned out to be a very, very good project from all our Lions clubs. Lions have accepted diabetes as one of our global causes since 2017, like 3-4 years back. Our goal was to have the awareness, education, and early detection of diabetes so that it can save lots of lives and better the standard of living for many of these people. The vision sight has been a core cause of Lions since 1925, and one of the major cause of vision loss is diabetes, the diabetic retinopathy. So this was close to our heart. We were always working on this, and we will work on this forever. We had the three sessions for this particular symposium. In the last part of the second symposium, we did talk about several projects that Lions undertake. If you are a Lions Club on the call, and if you want to, plan for some projects, there is a lot of support that is available from Lions International, as Lion Mary and Lion Emily talked about. There are lots of resources that we have. We need to take advantage of that. I'm going to share the Lions page, landing page for diabetes for a moment, for you to see what this particular page provides. We have the facts, we have various planning resources. We have, like, if you want to have a stride walk, we have resources there. We have a type 2 screening. How do you do that screening? We have resources available. We talked about a diabetes support group several times during these presentations in today's session and the last Tuesday's session. So how to do that? And then the diabetes camps is the another part, and how to manage those is been all this information is available on our international website. There are these resources that you can go and work on. The one takeaway from this, when we started this discussion about this particular symposium a few weeks back, and what came out of that is about the peer support groups. The Rutgers University, where Shailja Mathur, Dr. Shailja Mathur and Suchi are part of, and Lion Anju and Suman have been working on. We also have a couple of other Lion members who are part of that group, specifically Lion Radha Malik from Middlesex Visionary Lions Club. With all these resources that we have, along with Rutgers, we are planning to start a peer group if we get enough interest. If we have interest locally, we would surely start a peer group which can meet in person, especially after many of the people with diabetes have gotten their vaccination. Most of them have got their second shot by now. So we will start an in-person peer group. So if you are interested, please let us know, and we can provide you with the information on how to join that group. In our programs, this program as well as our LEO's programs for leadership every Sunday, we get Lions and Leos from all around the world. So if there is an interest, if you are interested, we can start a virtual peer group, which we can bring in several speakers like this, not in a big symposium in one day, but for probably in half an hour every week. We will do that, and we will make sure that firstly our Lions and Leos are healthy, and then they go out and sort of help others with this awareness and education for this dreaded disease of diabetes. As I mentioned a couple of times today, that like I am suffering from diabetes for last 6-7 years, and I personally know what one goes through when we have diabetes. I had like a couple of the episodes where my blood sugar was extremely low, and it was really, really scary. And that is what probably many people don't understand till they go through this. And I really pray that we should not reach to that level. We should keep ourselves healthy and make sure that we are all safe, and we take care of this disease. We can, as many say, that we cannot completely cure that, but we can control the diabetes. One thing that is that the Lions, this diabetes resources have, that there is a risk assessment test that the Lions are developed with the International Diabetes Federation, IDF. There is this test that we have, which you can take to sort of knowing it, that you can prevent. Like if you are pre-diabetic, you can work on it, and we can make sure that we don't get into the bad part of this pandemic. So you can go and take that test. It is Lions branded. It is the resources are available on Lions website. It is also available on idf.org. That is the International Diabetes Federation's website. Having said that, like as Lion Ezio mentioned, one of my friends, a Lion from India, Lion Vinod Devasya, he saw this International Diabetes Federation website and thought that like how can we motivate our clubs to do more service with this risk assessment. It is critical, and we need to do something, especially during the pandemic. So during the beginning of this pandemic, Lion Vinod has developed the application which looks something like this, and it helps in doing exact same thing that the other application does, the IDF application does, but it also gives your club an ability to promote. It can be your it can be your this thing. It can be your club activity, and you can sort of report that in My Lion. There are several certificates available. If you go through this website, diabetesrisk.org, right now it is like sort of under remodification for the new year. There are a few changes that will be coming up in next couple of months, but you can just take a look at it for now, and we can sort of if you have any questions, you can reach out to me or Lion Vinod, and we can work on it. That is the information that I wanted to share with you. Now we are really at the end of the session. It was really a great experience for both me and Lion Anju. We had to go through a lot of screening of the speakers and getting the things in place, and I believe that like we got a good menu for you to go through. We had really good guests. I'm really thankful to them. On Tuesday, March 23rd, which is officially the American Diabetes Alert Day, we had Dr. Acharya from India. We had Lion Lori Shihan from Minnesota, and we had Lion Payal from our own New Jersey Fitness Lions Club presenting. We are thankful for their knowledge and sharing their knowledge and letting us know how we can keep ourselves healthy. This morning, we had this type 1 diabetes symposium. We had several good speakers. We had Lion Donna Friedel. She is the multiple district chair and District 16L chair for diabetes. We had Lion Barbara Cozero. She is the chair for diabetes in District 16N. We also had Tom from JDRF. He also spoke. And we had a cute little girl, Leila, and her mom. They have presented in various Lions events, including the International Convention and Lions Day at United Nations. That was a great experience for all of us. I would really thank them for bringing in all that information and helping us with that in the morning. This session focused on type 2 diabetes. It was mainly focused around the work that has been done by the Rutgers group, the diabetes self-management group, headed by Dr. Shailaja Mathur. We also had Dr. Suchi, who presented, and Anju. I am not going to thank her; she's part of us. But Anju and Suman also presented a great session to talking about how to manage the diabetes. After that, we had Dr. Mike and PID Bruce, and the Governor Sammy couldn't make it. He has his cabinet meeting at the same time, but he did send us a video about what they do, and I'm really thankful to them. Lion Ezio is literally, I did not want to say this, but I have to, because it is literally a last minute. I asked him last evening about presenting about this, and he agreed, and he worked till late last night to prepare this presentation. I'm really thankful for what Lion Ezio brought to the table. I'm also thankful to Lion Emily and Lion Emily from LCIF and Lion Mary from LCI Service Division for putting up a really great presentation for all our Lions to understand what support that they have from our international organization. Then our hosts. The Tuesday's program was anchored by Leo Ojes Chitnis. He sort of whenever we need some anchoring, he's right now, that is the person I can push and become the anchor at any point of time. So he had to do it, and he did it. He did a really good job. This morning, Lion Donna Riddell, she did an exceptional job in hosting a very, very emotional segment for all of us. I'm really thankful for Lion Donna and Lion Barbara for hosting the event this morning. And now my co-host, co-chair on this, host for this evening was Lion Anju. She not only hosted the event, this third segment, but she was doing a lot of running around. We were going back and forth about a lot of things. Again, I'm going to embrace her a little bit. It is her birthday today, so I wish her a very, very happy birthday. I now know that she didn't want me to say that on a public broadcast, but even on her birthday, she is sitting in front of computer for most of the day and managed the entire show.
Thank you for your best wishes. This was my pleasure to be able to contribute.
Thank you. Then no event is successful without the funding that we get. Many times we keep feeling that it's an online event and you hardly need any money. That is not true. We need money for several things, and we had several good supporters. We had Ande Plaza Pharmacy. They offered us, right when we started discussing, they offered us free glucometers to be distributed to anyone who wants it. The early detection is a key. So we really are thankful to the pharmacy for giving us the free diabetes meters. Anybody who wants these meters, you can just write to us at diabetes@visionarylions.org, diabetes@visionarylions.org, and we will home deliver these glucometers to you so that you can check your blood sugar. And they also, Ande Plaza Pharmacy also promised us that if someone needs the maintenance medication and they don't have insurance and they are suffering and they have a prescription, a valid prescription, if they reach out to Ande Pharmacy with this phone number on the screen, 732-431-9400, they will give free diabetic medication for anybody who has the prescription. Also, we were helped by Meena Upadhyay. She is a financial service professional. She jumped right in the beginning on board, and she supported this program. If you have any financial needs, you can reach out to her. Her number is 732-529-5814. We had several of our Lions and friends who also supported us with their sponsorship. Pooja Amit Azad, Lion Jyoti Sahani, Lion Lirvati Taneja, Seema Chawla, Navrang Dance Academy, and Chitnis family. We all contributed to make sure that this program runs efficiently and without any hiccups. Besides that, we always need a lot of support from the team. Our symposium team consisted of my co-chair, Lion Anjupuri, Leo Ojas Chitnis, Lion Palav Hadia, Lion Ritu Luthra, Lion Geeta Mahajan, Lion Gitesh Malik, Lion Radha Malik, Lion Varsha Nayak, Lion Pratibha Nishkavde, Lion Jyoti Sahani, Lion Pranali Sonduskar, and Lion Revati Thaneja. So I thank all of them for supporting this event and making it the great success that it was. Now, last but not least, I thank all of you who attended the event. There is a lot of attendance and a lot of involvement by all of you. Without you, this wouldn't have been possible. So thank you so much. And we would continue to have that discussion and make sure that we support ourselves and our communities in the needs of the education awareness and early detection of diabetes. So thank you so much.